Government Ayurveda Medical College, Mysore recently had the honor of hosting a landmark continuing medical education program exclusively designed for the esteemed teachers of Samhita and Siddhanta. This impactful event, organized by our Department of Ayurveda Samhita and Siddhanta, was made possible through the generous sponsorship of the Ministry of AYUSH, Government of India, with the support of Rashtriya Ayurveda Vidyapeetha, New Delhi. We are delighted to share the complete recording of this week-long academic journey. Watch now to gain valuable insights from our distinguished speakers and relive the spirit of knowledge sharing and academic excellence.
Now, the session is led by Dr. Ritesh Gujarati. Sir is a professor and head Department of Basic Principles at J. Patel Institute of Ayurvedic Studies and Research with 18 years of teaching experience in fundamental principles of Ayurveda. He holds a BMS from North Maharashtra University, MD from Gujarat Ayurveda University and PhD from Tilak Maharashtra Vidyapeetha. An accomplished academician, he has authored 4 books, published 30 research papers, and delivered over 160 lectures across institutes. He has actively participated in faculty development programs, seminars, and webinars contributing to academic enrichment and knowledge dissemination. Dr. Gujarati is committed to improving the quality of Ayurvedic education through competency-based curriculum and healthcare compliance. His focus lies in fostering excellence in patient care by identifying opportunities for better practices and ensuring safe, effective, and compassionate treatment. Through his dedication to teaching, research, and healthcare, he stands as a respected figure in Ayurveda academia.
Conducting RAV CMEs at my institute, almost 11 CMEs I have conducted from 2012 to 2022 for all departments. I know it is not easy to conduct these kind of programs because from proposing, then getting the sanction and now finishing it, everything, getting the resource person, you will have many cancellations from the resource persons, then selection of the participants, cancellations of the participants, and then actually conducting the programs. And not only that, after this, the main job is finance. So for UC purpose, you need to collect all the documents, everything should be properly, and also managing PFMS. So it is not easy job. So once again, let me congratulate the department and the institute, also to all of you who are sitting here, because being that to continually for 6 days, that is not easy. Last CME I attended in 2010, then after that I didn't dare. Because for me to listen for 6 hours is very difficult. So once again, congratulations. And I have the report that the participants are very good. They are very interactive. And the sessions last 4 days, they were very good. So I hope whatever the benchmark has been set by previous speakers, I'll try to come up with that. I'll not say I'll go beyond that, but at least if I can maintain that level, I'll be happy. Correct? Now, talking about these 2 topics, the 2 topics that has been given. Now, if you are aware about the pattern, how these CMEs are designed. So, previously there were like 90 minutes lectures were there. Then they came up with the idea that like CBDC also, like 60 minutes there should be a talk and 30 minutes there should be some kind of activity. But unfortunately, I selected both the topics because most of the topics were given. Somewhat I got a call, but I couldn't confirm then the topic. By the time I called back, most of the topics were gone. Whatever PPTs were ready with me, they were also like taken by other resource persons. So now whatever topics that has been given to me, rather chosen by me, in both the topics, there is no activity. Because this is only a lecture-based kind of thing. Because you cannot have an activity on Naishthiki Chikitsa. You cannot have an activity on ethics. So please bear with me for that. Correct? Now, the first topic that I'll be talking is ethical practices mentioned in Ayurveda. Now, both the topics are not new for us. We know Naishthiki Chikitsa, Charak Samhita has got full rights for that. Nobody talks about Naishthiki Chikitsa. For ethics, yes, because here you can see it is mentioned in Ayurveda. So various Ayurveda Samhitas have got the details about ethics. Now first, before I start my presentation, can you tell me what is the need of this? Because this topic has been kept in a teacher's training program. And only Samhita department can dare to do this. Because from my like UG days, then post-graduation at Jamnagar, then PhD, and my 18 years of teaching experience, one thing I have, like whatever feedbacks I have received, that all students, you take UG, PG, even PhDs, most of the ethics will be followed by this department. And so kudos to all of us for that. I hope you will agree with this. Because and this is not like we are boasting something. This is the feedback we get from our students. No, sir, for your department, it is good. We don't have any complaint. Other departments still, they are struggling. So certainly, and that's why only Samhita department. So whosoever has prepared, designed this syllabus, very good, because both the topics are new. Very rarely they are touched, because ethical aspects will only be taken care by ethics committee. And very rarely Samhita people will be there in ethics committee. There will be other departments, preferably Rasa Shastra, Dravya Gun, and other clinical departments. They will be part. Even majority of the research projects which are taken by our faculty or students, faculties, as well as at PG level, very rarely we deal with, if you have got a clinical study or human surveys are there, then only we will be dealing with this aspect. But now, like ethical practices mentioned in Ayurveda, so what is the need of this? Why we are talking about this? What do you think? Because it is not about ethical practices mentioned in Ayurveda. Every professional field must have their own ethics. And majority of the ethics will be common. Isn't it? We cannot have separate ethics for engineering. We cannot have separate ethics for medical or other professional courses. So ethics is something, it's a very umbrella is quite big, where all education field or working professionals, everything is covered under this umbrella. So I would love to talk about this topic. Now, what do you think? Why we should talk about this? What is the necessity?
In Chatushpa, Shuchi is given as a quality of the patient.
Yes, correct.
So it is Kayik, Vachit, Mansik, all of it.
Correct. So whenever we are talking about this, when we'll be going through the slides, that shall be the Papa Karmas. We need to avoid. Then Charak Samhita Sutrasana 7th chapter, he also gives the details, where certain criteria or certain, we can say certain lines are there which are going towards ethics. But then why we are talking about this? Okay, it is there. Compromise. Majority of the ethics are getting compromised, not only in our field, in every field. And this was predicted in Charak Samhita, Vimansthan, Janapadodvans, Yugya Yugya Dharmapadaha. From there we start. So they knew at that time also that day by day when we are proceeding towards Kali Yuga, this is going to compromise, and this is what we are seeing. So 21st century is rather the most important century where we should talk about this, isn't it? Now, what kind of practices which are going on where we feel the ethics are getting compromised? Any example from our field, from other fields? Or malpractices, like what? Because every malpractice, after that a rule comes, correct? And that rule generally goes in line with ethics. Previously rules were there, they were not followed, some malpractices started. Then after every malpractice, they will come up with certain guidelines, and majority of the guidelines will be in line with this kind of ethics. So what kind of malpractices we are talking about here? Because we can talk about education, we can talk about research, and we can talk about clinical practice. These are the three areas where majority of us are dealing with. So we'll start with education. So where you feel that the ethics are getting compromised? Because whatever shlokas I am going to show you, majority of the shlokas and their commentaries you know. What is important is, what do you think about ethics?
On paper teachers.
On paper teachers. Okay, that's the administrative part, but yes, that's a very severe kind of ethical compromise. Teaching quality. Like what? Which ethic?
Many of the teachers are not following the teaching to the center, and many of the teachers, I hope this looks like an acquired bit. Many of the teachers of Samhita Siddhanta, they are not knowing the core subject, which are basics for the Samhita only, but they are ready to teach for the students.
Okay, so it means they are not that much trained, correct? If somebody is not trained, because when we are talking about teaching learning methods, actually this has been talked since very long, that whosoever completes MD, immediately now that with NTET and everything, that has been addressed. Previously it was not there. Now, at least theoretical aspect, we know that whosoever has cleared those exams, at least those persons are knowing that what kind of teaching learning methods. So if somebody is not trained in teaching learning method, goes into education or teaching learning methods, whether that's an ethical compromise. So somebody who is, and this is applicable for everything, somebody who is not trained in research, doing research, somebody who is not trained in ethical practices in clinical practices, doing a clinical practice. So it means every person needs to have formal training in whatever or whichever profession he or she is supposed to enter. If they are properly trained, then we expect, we cannot, because we know malpractices are done by those persons who are having better IQs than those who are having less IQ. Because doing malpractices, you need to have a very, shaurya is required, isn't it? Correct? And a very good IQ is also required. An ordinary person cannot do. So whosoever is doing these malpractices or compromising ethics, they are very well aware about ethics. But then also they are compromising. Then how I can say, or we can say, that they are trained, because the first criteria they have met, but still they are compromising with the ethics. How we are going to address that? Because first criteria in discussion we said, okay, as they are not properly trained, that's why, so that cannot be considered as pragyaparad. But when you know, and then also you are compromising with the ethics, then that is pragyaparad. Any other practices?
Fake documentation.
Fake documentation with more norms, with more QCI things. Now more ethical practices, though the teachers are not ready to compromise, but they are forced to do that. No, you do this. Correct? So, and why this has happened? Because our standard was at this level, and we have been asked within 6 months that you reach to this level. There is a pressure from government side. I have visited best of the government institutes, best of the private institute for QCI. Majority are now in C grade. Correct? But now there is a lot of pressure from government. Government is telling, we are giving you crores of rupees in the salary and instruments. Why you are in C grade? The same is for private institutions, for admissions and everything. They require good grades. Correct? So now how you will, so there is a shortcut. So ideally we are not supposed to adopt that shortcut. But in a short span, everybody wants to go from C or like beyond C. Now everybody wants to reach to that level. So there we are compromising. Any other thing?
Passing everyone.
Yeah, most important. And in government colleges, still it is a better scenario is there. In private, and that too, if it's a private university, then it's very difficult. Like principal as well as management will call everybody and they will bombast that, okay, 100% result should be there. This is total nonsense concept. And the problem we are facing, I am working in a private university, but I am doing something different. I have a group where 30 to 40 teachers from all over India, they are there. Repeatedly, every exam I post, we do not want 100% result. This is the kind request. Nobody is telling you to give 100% result. If it is 50%, if it is 60%, we are happy. In medical field, 100% is a myth. Because 1.5 year, all PAs, all TT, TT1, TT2, he is barely getting passing marks, and in final exam, flying colors. So that is, but now who is responsible for that?
We are
I am also working in a private college, correct? I have also pressure, but still I dare to tell my principal that I am not going to do this. And the benefit is that all the students know that there will be no compromise in Samhita Siddhanta department. All assignments should be timely completed. Everything should be timely completed. No buttering is required for any of the teacher. You do your work, you will get the best marks in your subjects. But now who will do this? And the problem is that not only management, even faculties. In our college also, there are few departments where it is told, no, it is not good. It's a private college. We should give 100% result. So we need to come out from these kind of things. Because if we cannot follow, then how do we expect that our students are going to follow these kind of things? So yes, teaching, learning and examination, many malpractices are going on and ethics are severely compromised. Now let me share with one anecdote that you might be aware about Professor R.R. Dwivedi. He was my guide at Jamnagar. Now, like when for various exam, I used to go there as an examiner and everything. We used to talk with him, and I used to tell, sir, day by day the quality of the students is like deteriorating. I know, what is your opinion about that? Do you feel the same? Then who is responsible for that? Because after telling me, it was like U-turn. He told me, then okay, you tell me what is the reason. You are my student. I am happy with the quality. You are not happy with your student's quality. Who is responsible? We are responsible. Na? So when I am telling that the quality is deteriorating, indirectly I am telling that my quality is also deteriorating. Isn't it? I am not updating myself. Because, okay, I have done MD, PhD, but if I am not reading enough, correct? I am not updating the skills, because these are also, teaching, learning is a skill. You might have gold medal, correct? But if you are not good communicator, then what is the fun? The teachers are not, the students are not ready to attend your classes. They are getting bored. They are sleeping. They are like going through the mobiles. Then the finger is towards me. Isn't it? So somewhere, I am happy with the department. My department is all of them. They are all good, and that's why we could keep the quality. So, but again, like when we are talking about the qualities are getting compromised, somewhere we need to introspect, isn't it? Any other practices where you feel?
Attendance is being given to them.
Yes, attendance, because a student who is getting, say, 70% attendance, correct? This time you have allowed him to appear for the exam. Next time there will be one more student with 69%, then 68%, gradually. But if at 74, we are detaining him, nobody will dare to have 74.5. But again, who is going to do that? Obviously, your academic council is for that purpose. So, though you are working in a government institution or private institutions, we need to have strong ethics. Sometimes, like telling all these things is easy, but to implement it at ground level becomes difficult. But we have to do. We have done it at our institute. It takes time. It takes time, but with 18 years of my, I have only, like total in 18 years, only 2 institutes. 2 years at first college, and now 17 years, 19 years, 17 years I am at the same institute. And now I do not have these kind of complaints. So certainly, somewhere this whole presentation, and after that, because when you are ethical, then only you become eligible for Naishthiki Chikitsa. So fortunately, I have got both the topics where they are related actually. Because for Naishthiki Chikitsa, when we talk about pravrutti and nivrutti, it is nothing but the do's and don'ts. And whatever do's we are talking about is nothing but sadvritta, isn't it? Are there any other things that you would like to tell me? Okay, these are the areas that, okay, this is told in
What would the admission to colleges?
admission to colleges. But how it is like ethical practice?
Like it is just based on the, like I mean it's at the institution level or the government level. It is only based on the marks.
Correct.
But earlier it wasn't like that. It was about the interest of the student to get into this field or that field.
Correct.
Right now it is, if you're not getting MBBS, we can see most of the students coming to BAMS.
Correct. But now it is a ethical practice, because the norms have, because after this slide, I'm going to talk about ethics as well as morality. Correct. Whether they are synonyms, ethics and moral, there is difference. We'll be talking about that afterwards. After that, yes. So, yes, you were talking about admission and everything. There are certain norms, correct? That has been designed. Accordingly, we are getting the admissions. So, I'll not consider it as unethical practice. Because the norms which were there maybe thousands of years back, the criteria was different. Now the criteria is different. Now we cannot go to the practices which are there, prevailing there 2000 or 3000 years back.
But we can see the students, they just come here for a degree.
Correct.
It is not about practice for them. It is about just taking a degree of BAMS and going and practicing something else there.
The only answer is yuge yuge dharmapadaha. Isn't it? Because how many students are, I don't know what is the scenario in Karnataka, but in Maharashtra, in other state, Gujarat, from you go to North India, there is always the major ethical compromise is doing allopathic practice. The thing in which we are not trained, and if you are doing that practice, that's the most unethical thing. Correct? But still it has been, because now from government point of view, they do not have that many doctors. Correct? So now this backdoor entry will be there by the time they get sufficient doctors. Now the saturation is going on. When I started my academics in Gujarat, there were only 3 government colleges and 3 private colleges. Only 6 colleges were there. Now the number has gone to 40. Within 2-3 years, it will go beyond 50, 60. And the same scenario is almost in every state. So whenever we will be having more and more doctors with this kind of degree, government is not allowing us to do this cross practice. Somewhere, and Ministry of AYUSH is working in that line only. If you see in the last 10 years, there is not a single decision which has been taken by Ministry of AYUSH which says that we can do allopathy practice. Not at all. So from their side, they were very clear. Let me tell you, when I was doing PG at Jamnagar in 2004, Mr. Modi, that time he was a Prime Minister of Gujarat, he came there for an international conference. There was a hall, almost 500, 600 PG scholars and doctors were there. In 2004, his vision was do only Ayurveda practice, then only we will support you, otherwise not. And the same scenario after Ministry of AYUSH you can follow, the same vision is carried forward. So, okay, these are the norms and like whatever admissions here we are talking about, I'll not consider that as an unethical practice. But yes, students are like, these are backdoor entries. And in this only, like if you remember, there is one shloka in Charak Samhita which says, Ragnyaha pramadat acharati. Why this is going on? Because the government is not doing. So who is responsible ultimately? What you are telling about is system. The first day when somebody was doing allopathy practice, if he was detained and kept in a jail for a few years, nobody has dared to do that. So Ragyaha Pramadad Acharanti. So these things are going on at government level. Government cannot also come with strict norms because they know, yes, our people are doing good work at primary health. Okay, so that's why. So, okay, that part will keep aside. Any other things? Competition between? In which sense you are talking about? You are talking about NAC rating or QCI rating? Huh?
Good results.
That we have discussed now, 100% result, that's a myth actually in medical science. Nobody says this. But now, again, these are the unethical practices which are promoted by some institutes. There are some institutes which says that you take the admission, we'll guarantee you UG, PG, as well as PhD also. You stay here for 10 years and after that we will absorb you as a faculty. And whatever fees you have paid, even we are not going to pay 10% of that as a salary. This is a scenario. There are institutes, every state we have got such universities.
Survival problem of boys, especially in male category. So they are practicing allopathy.
I'm not against that, madam. But yes, when we are talking about unethical practices, it is one of the unethical practices. Until and unless government allows, and we are not trained now. Nowadays, we are having this new syllabus where multiple, like every subject, except our syllabus, every subjects will have, now modern, they have included so that backdoor entry is still supported, but somewhere still it is unethical. But now as the government, now we must understand this, now the government doesn't have the vision of allopathy practice, Ayurveda practice, homeopathic. If you see NEP, National Education Policy, it is now integrated. Now they want to train the doctors that you need to have the education of all pathies and whatever best for your patient. If it is allopathy, if an emergency comes, you treat him with those emergency drugs. If chronic disorder is come where you feel, but he must be trained for that. Na? So 2030 was the vision. And they have started, one college has already been identified where integrated course will be there. Though there's a lot of pressure from IM and everything, but if this government continues for the next 10-15 years, certainly we can hope that, because we cannot be saying that, okay, whatever there was 5,000 years back in our Samhitas, it is applicable day to day on daily basis. It needs to be updated. Na? So if we are having the knowledge of modern allopathy, or say physiology, pathology, X-rays, CT scan, yes, doctors are using. Now if you go to All India Institute of Ayurveda, they have got very good radiology department. Labs are ultra modern labs. Okay, so this is the vision actually. Now it is at the top level. It may take 15-20 years to reach to the ground level. So now maybe after that it won't be unethical. But currently it is, as the norms are there, we can say. Any other things?
Not providing enough infrastructure.
Yes, that is unethical. And again, who is responsible for that? goes for inspection?
Definitely not obscure anyone here.
No, I said, ma'am, I'm not talking about he or she, I'm talking about us. We are all teachers. There are teachers. Because being a private college faculty, you know that from 2021, I think they are allowed, 2022. Then I started going. But every time you go institute, they'll offer 2 to 5 lakhs of rupees have been offered. So you please take, and you don't change your report, you just take this money. But now, like we are telling them, please, this is not the vision at the top level. But yes, I have seen some visitors along with me, they are taking money. I have reported it. So somebody has to do that. If now, is there any visitor here, NCISM visitor? Nobody? Okay. So if you are aware, this time some exam was conducted. Do you know what that exam was about? Huh?
For inspection, they have the
Assessors exam. No, I'm not talking about QC, I'm talking about this NCISM visitations. There was some exam was conducted, correct? Do you know what kind of questions were there? Huh?
Most of them were related.
Because I was a part of that committee who designed that. I should not tell this, but because like very commonly it was discussed that severe ethical compromises are going on. So how we will do that? Then it was decided, let us do some, because they know the names that who are doing unethical practices. They are already now, they were the visitors. Now they conducted the exam and they tried to remove at least that pool. As far as, I'm not telling 100% has been removed. I know personally with names and everything who has taken how much amount at which college. Correct? But like now the problem is that we are all adults. Correct? Now if you ask me that what is your opinion about taking money at college? What should I answer?
Taking money to college.
For a visitation purpose. If you are going there and if a money is offered to you, what you will do? What you will do? Obviously, he knows why this question has been asked. Whether I'll answer, yes, we should take the money. So the person will write, no. So the questions were like when we started doing that, I think I gave almost 200 to 300 questions. But with that only, I told them, this is the futile exercise. Because if you are asking a thief that what do you think about, okay, what do you think about that persons who are stealing? What he is going to tell? Whether he is going to tell that, okay, I am going to steal the things. Or this is, no, obviously nobody is. So when these questions were designed, most of the questions were like that. And I told you that whosoever is doing these malpractices, they are more smarter than us. They know how to do these things without knowing. So certainly, even they were also qualified. Because when the committee was doing on this, that time also I told, okay, you do this, but I am sure that nobody is going to give the correct answer. Everybody will give the answers that you want. So the same thing happened. So at that level also, there is a lot of discussion that some unethical practices are going on. But most important, whosoever is a part, previously NCISM members were there, CCM members were there, that time we used to tell, okay, they are, but now our faculties are there. Na? Not only that, for QC also money is being offered. Correct? Because colleges are habitual for offering the money and teachers are habitual for taking the money and they feel it is their birthright. Correct? The way they boast the things there and the way they behave. Because whenever I am visitor at college level or at Delhi, immediately as the visitation starts, immediately I take a meeting of all the 3 assessors, please behave properly. If you are senior, if you is 10 years senior to me, then also I'll tell him, sir, please do not bang them. Whenever you are going, you are shouting. Because this thing happens, you start a visitation, they'll start shouting for next 2-3 hours. They will try to pressurize the college, they will try to pressurize the management and the rate will be increase. I tell within 5 minutes, if you'll do this kind of things, immediately I'll quit this visitation, I'll report this to NCISM. Within 5 minutes only. So behave properly and whosoever is sitting at Delhi, he should only be observer, he will not be asking a single question. You are observer. If you have got any problem, because that is the ethics, that has been told to the assessor that you should not interfere. Let them do. If during assessment they might have forgotten, you just remember, you just give them, okay, you have forgotten this thing. So that kind of things. But again, Because say, whenever you are doing assessment, whenever all these things are also, there are ethical practices. And everybody knows what kind of ethical practices need to be followed. But unfortunately, we as a teacher are not complying to those norms. So why I am talking about this, that whenever we talk about any unethical practices, say for clinical and research, clinical practices, you'll be writing the prescriptions, the medicine he'll be taking cut from those shop owners. That is very common practice in government colleges as well as private colleges. Correct? For research also unethical practices are going on. The data we know, we know those institutes where there are not 10 patients in comorbidity and they are doing PG, PhD also in comorbidity. They are providing those kind of degrees. So from where the data is coming? So that is the unethical practices. So what I feel is when we, as a teacher, we are talking about unethical practices, we ourselves are responsible. If wherever I am working, if I can clean up that area, if I am working in teaching, I should make example that this is the way teaching needs to be done. If I am an examiner, if I am a researcher, if I am a clinician, those strong benchmarks we need to set. Previously they were there. Somehow deterioration has happened, but we as a teacher can only set those benchmarks. If we cannot do, then all 30-40 years, whatever we are in teaching profession, we will be complaining, we will be blaming all the system and everything. Correct? So what I feel is when we are talking about ethical practices, all the fingers are towards us only, that you are responsible. If something unethical is going on, what you have done? If you are telling some unethical practices are going on since past year, what you have done for that? And certainly wherever you are working, if it is a private, if it is a government, there is a way to at least address those things in a very soft kind of manner. First year, second year, third year, they won't listen, but fourth and fifth year, they'll understand that we must do these kind of things, correct? So now, yes, these are the contents for my presentations which are given by NCISM. Previously, when I was preparing this presentation, I thought that I'll go along the same kind of sequence which is there. But while preparing, I came to know it is not possible to separate all these things. Because Achar Rasayan talks about morality, Sadrutta talks about morality, Shishtachar Vidhi is nothing but Sadrutta. So there is everything is mix and match. Okay. So we cannot have the slides first, we'll cover moral, then gesture, then. So everything, all all these topics are related to ethics only. Now, yes, correct. This is for all of you that I have taken some liberty because when we are talking about ethics, agree with this? Yacha anyadapi kinchit syat anuktam, nothing wrong, na? If you feel in 21st century, if these ethical practices are needed, somewhere they might, because those kind of smarter people were not there, na? So that time it was not needed. In Satyug, there was no need of ethical practices because everybody was following ethical practices. The need has become more now. So now, some articles title I'll share. Okay, the link presentation I'm going to share. So you can click. This is only about medical field. So now you say, look like about modern medicine and Medical Council of India and their doctors, they are so open. You show me one article which says that morality of Ayurvedic doctors has been compromised. Can you find one article? We feel, okay, we are the best person, we are the, and now all of us, we have discussed for last 10 minutes what kind of unethical practices, and we are part and parcel of whatever we are doing. So a study of moral values in students in a medical college in southern India. This is from southern India only, where we are standing now. Then, a loss of moral values during business like transformation in healthcare. Now healthcare has become a big business. Billions of dollars are involved. So majority of the unethical practices are going on. With COVID and everything, lots of cases have come into picture that what kind of unethical practices are going on. Then exploring moral competence regression and narrative approach in medical ethics. Very beautifully, this is only a sample, 5-6 articles. Professional values and ethics in medical education. As a part of Samhita, in every Samhita, there's a lot of discussion about morality. In their books, there is no thing. Like the way it has developed, gradually they have come across with that their doctors are only indulged into unethical practices. So that's how they have to create this ethical committee, ethical practices. So they are addressing it, and they are addressing it very honestly. Now, yes, ethics and morality. Just tell me whether you do agree with this. Because previously I was talking about whether both the words, they mean the same. So if you go through the definitions of ethics, it says a formal set of principles. Formal word is very important because it has to be decided by or designed by a top level committee. Correct? So formal set of principles or rules that guide behavior, often established by professional organizations or institutions. I cannot write an ethical code at my home for my family members. So it needs to be a very formal kind of institutions, organization, where multidisciplinary committee will sit, they will decide, and accordingly the guidelines will be passed on to pan-India, so that needs to be followed. Now morality is, this is important. Here is the formal set, it is a personal, more personal or societal, because we are part of society also, correct? So it will be decided either by that person, how he is born and brought up, accordingly the sense of morality is going to develop. And society, if he is a part of a society where stealing is a very routine practice, then he will feel that there is nothing wrong in stealing. That is morality, because the definition of the morality changes person to person, whereas ethics remains same. But now when we go through our Samhitas, there is no clear-cut demarcation between ethics and morality. So when we are talking about a term ethics, we will be talking about both ethics as well as morality. So, and yes, what is important is societal sense of what is right and wrong. Simply I am at a signal at around 8:30 or 9 o'clock, nobody is there, I can directly cross it. Okay, but still there is a red signal, I am stopping. Whether that will be ethical practice or moral practice? Both. It is ethical because the norm is there, but at night nobody is there to watch me. Then also I am following. So morality also, so both are, sometimes both will go hand in hand. Now let me give another example. For example, abortion. Okay, different countries will be having different norms. At one country, it is considered as, okay, it's a routine practice, nothing wrong in that. At one country, they will see, no, morality is very wrong. So the same thing, person to person, it changes. So when it changes, it is going under the title of morality. When it doesn't change, when it remains universal, that will be considered as ethical. So influenced by individual values, and what is important, that's why I told you how the person is born and brought up. That is going to define the morality of that particular person. Say very routinely, now the kids are at home, and if you are at home and somebody has called you, and you just telling him, okay, yes, I am on the way, I am about to reach to your office. Now the kid is watching. You are still in the house, still you are telling that you already reached there within 2 minutes or 5 minutes, then what kind of example we are setting? Isn't it? So, like if mother, father or everybody in the family is doing this kind of things, then from that kid's point of view, there is nothing wrong in lying. So if one day he also does the same thing, then for him or from his moral point of view, he is right. From other person's perspective, you might be wrong. So that is the difference. And yes, from like we can have several examples for religion. Let us take an example of vegetarian, non-vegetarian. Morality, ethics, ethically we cannot tell that you should be vegetarian, you should be a non-vegetarian. But how I am born and brought up, accordingly it is designed that I'll be a vegetarian, I'll be a non-vegetarian or other than that, correct? Now, so difference in the application. So morality varies individually, person to person it changes and includes personal beliefs. What you believe in, that is going to help you to decide, which may not always align with professional ethics. There was a very beautiful article which says that moral dilemma has become a very big problem for medical scholars or medical practitioners, because sometimes ethics is saying something different and morality is saying something different. So majority of the time, both these terms will be going hand in hand. But at some places, morality says something different and ethics says something different. Now the doctor will have to take the call, what is right and what is wrong. So there's a competition between morality and ethics. So aligned with professional ethics standards, ethics represents the collective codified standards. Collective because everybody has given their opinions that medical professionals are expected to uphold in the practice. Now, what are the importance of, do you know what is MQ? What is MQ? IQ you know. EQ? MQ? What do you know about that? Because there's a lot of discussion about IQ, EQ. Previously it was only IQ. Then they thought those who are having good IQ, they are not good citizens always. Correct? We want good citizens. So along with IQ, we need to have good EQ. Now that is also not sufficient. IQ, EQ. Now it is MQ, moral quotient. There's a 10-point scale which says at which level you are standing. You might be very bright. Your IQ might be good, but morally you may be wrong. And when we are talking about a good society, we want a person with good MQ. He is better than a person who is having good IQ and EQ. So there's a lot of discussion. Do you know anything about social credit system? Social credit system.
We don't have it in India.
Yeah, agree. And that's why malpractices are going on. What is social credit system? There are few countries. China is the first one to talk about that. They implemented, but again, a lot of problem was there. From 19, they decided that, okay, 20, they are going to apply. In 2025, they are still struggling. Previously, they wanted to make it compulsory. Now, why? Because, you will be observed 24/7. घर में तो ठीक है, but उसके बाद whenever you are coming outside, continuously under CCTV, if you are at a signal, if you have broken the signal, that's a negative social credit score. According, say if you are a defaulter, it's a negative. Now also we know for loans and everything, credit score. What is credit score? But credit score only talks about how good you are managing at your finances. It doesn't define about your character. Because all those Modis and Malyas, those who are settled in UK now, all of them were having very good credit score. But so credit score doesn't define that how morally good you are. And that's why China has come up with these kind of norms. And now what are the benefits? If you are having a good social score, then they have certain norms that you will be getting interest rates at a very low rate, okay? But if your credit score, social credit score is not good, it is less than 5 or that, then you will be getting loans but at very higher interest rate. Then you will not be given good jobs at government. Even you will be blacklisted from flying. So various norms they have created. If you are, it means if you are a good citizen, then government will do everything for you. If you are a bad citizen, then government is going to make sure that you suffer. So yes, now all developed countries and developing countries, they know that having good technical expertise is not good. If you want to have a developed kind of society and a country like India where we have a dream of 2047 develop India, which seems very difficult for me. I don't know. Personally, I feel that is very difficult because the day you, the moment you come out from your home till you reach your office, you will see multiple ethical compromises and people are least bothered about that. So there is no morality. A country where people are least bothered about morality cannot be a developed country for next 50 years also. And unfortunately, morality can never be forced. You cannot force anybody to do this is wrong, this is right. Because he will be doing only those things where he will be getting benefits. So certainly there will be shortcuts. So yes, if time permits, then certainly you need to go through moral quotient and social credit system. They are very good norms. Correct? And I feel India is the country where it needs to be adopted. लातों के भूत है ना, वो बातों से नहीं मानते हैं. So for all those लातों के भूत, social credit system is required. And fortunately, we are in a profession, we are doctors and we are teachers. Previously, both of these professions were considered as royal professions, not today. Why? Because severely the doctors and teachers have compromised the ethics. So, and we are expected to be the best kind of citizens, to set the best moral standards, higher. So, whatever money you are getting, if you are getting 50, 60,000, 1 lakh, the same colleague in government college is getting 3 lakh, 4 lakh, then also you are supposed to have that sense of morality. Because if you are a teacher, if you are a doctor, then it is expected from us. So now, yes, why it is required, why we are talking about this? Because it builds trust and compassionate care. Because the field in which it is the most important or basic underlining criteria, developing ethical decision. Because day-to-day life, we will be coming across with decisions, what is right, what is wrong. So for that, this is required. Promoting accountability. The teacher needs to be accountable for the skills that we are giving to our students. For QCI, correct? Now you might be doing our syllabus is competency-based syllabus. How many of you have identified the skills in a subject? Because we are the teachers who are in touch with the students for 4.5 years. Rest of the departments, their touch will be only for 1.5 years. So the most impact will be on the teachers who will be in touch with them for a very long term. So we have that accountability or even responsibility to make those scholars morally competent. Now, when we are talking about competency-based syllabus, first we need to identify the competencies, correct? And after that competency, you need to assess that competency. And not only assess, every student needs to be assessed for that competency. Say, for example, for Samhita Siddhanta department, you have identified 5 commentaries. 5 competencies. Like when this committee was doing, if you are aware, in QCI, is there anybody who has gone for QCI visitation? Or you might have faced QCI, correct? You might have seen that app. Those who will be sitting in the morning session in all those clinical subject sampling, and there are certain questions. Correct? And our department is not there. There were 2 persons, myself and one more. We also gave competencies to. So we basic Samhita reading is a competency. Commentary reading is a competency. Decoding the Samhita is a competency. If after 5.5 years, if the student is not able to read that Samhita, then he doesn't deserve passing marks. Ethically, it is wrong to give him passing marks. But unfortunately, that was not when all this, because they thought this is very tough. Because in the government feels that it is not possible in 4.5 years that they will be able to read. So that's why that was removed. Otherwise, almost 10 to 12 competencies were given. I was the person, and that we gave in 2019 or 20 when the syllabus. That time the committee was working for rubrics. To prepare, first you need to identify the competency. After identifying the competency, rubric has to be decided. Say for example, reading Samhita or even recitation of the Samhitas. That can be one competency. For that we have given certain steps and accordingly it needs to be done. Now day by day number of students are increasing. First will be when I started academics, 50 students were there. Then 60, then 100, now 150, 200. Now a class of 200, where I am getting weekly 1 or 2 classes, that too lectures activity, non-lecture activity, correct? And now if all those skills are expected in a student, that becomes a very difficult job. Not only that, you need to assess 100 students for those competencies. Very difficult. Correct? But now when we are talking about this, now who is responsible for that? If after 4.5 years, my student is not able to read Samhita, not able to decode Samhita, who is responsible? Isn't it? So somewhere we need to have those changes in the system. And I hope, yesterday I had a discussion with few of the participants, and we were having a common opinion that yes, scenario has changed after 2021. Because previously commentaries were considered as a very elite kind of thing, and only in post-graduation it needs to be done. But now my first year students can read some commentaries. Okay, and at least I can assure you 50% of the commentary they can read and they can tell you. What does it mean? 50%, okay, they're still UG, just hardly they're 18, 19 years. I cannot expect them to do. But yes, if you identify those competency, if you give your 100% for that, we are getting good results. And I can tell you now, 2021 batch in final year, correct? There are at least 7 to 8 students. Like the scholars, even they are far, far better than PG scholars to read and decoding the commentaries. I hope you might be having the same kind of opinion. So how this has changed? So it means there were some lacunas in the system. Who will identify the lacunas? Being a teacher, we are part of those committees. So we need to identify. And still I am having the opinion, because for all, like total this year, almost for how many 12 competencies are assessed. I feel Samhita department should also be there in competency assessment, because indirectly students understand that they will be tested for this. Now they are very serious for their practicals. They know that anybody will be shortlisted from the pool and they have to perform. If the same kind have been done for Samhita Siddhanta, I feel the results would have been better. But still I am taking the follow-up. I am in touch with QCI and as well as for NCISM, that please bring this. If you do not want to bring it first year, go it for second year or third year. Go it in final year only. But that needs to be there. So rubrics and everything is needed. It is already with QCI. So like accountability. Now the accountability is that, okay, my class is there 10 to 11, I'll go there. If I am getting 100% result, then I am a good teacher. Correct? There is a concept of good teacher and popular teacher. Correct? To whom you believe? Yes, I also. So, because good teacher cannot be a popular teacher. So now you have to decide you want to be a popular teacher or good teacher. Popular teacher, there is a shortcut. You go in the class late 5 minutes. You leave them early 5 minutes. Then there should be multiple jokes. Then students will be sleeping. Then you are a very good teacher. Sorry, a popular teacher. Popular teacher. For a good teacher, it's always a difficult. You will be on time, punctual. So 9 o'clock you should enter in the class. 10 o'clock, full busy. Whole day you'll be talking about the topics and no nonsense talk will be there. Assessment will be very tough in the exams. Popular teacher, okay, you will get passing marks. Don't worry. Bas ye mera kaam kar do. If you do this kind of works for me, you'll get good marks. So that's a popular teacher. So accountability and responsibility, we are not taking the responsibility as a teacher, isn't it? Until and unless I take control of that thing, because even the thing is that, like even the management in private colleges has happened, you give 100%, then you are a good teacher. Now it took me almost 3 to 4 years to convince that if the result is less than 100%, the assessors are good. So the criteria for my college is, if you give 100%, you will be eliminated from examination pool. You won't be teacher for my, you won't be an examiner for my college. If you are giving whatever genuine result, then we will going to continue with that. Because whatever teachers they were coming to us, they are coming from private colleges, and so liberal kind of exam is going on. Then we told them repeatedly that this is not good practice. And even yesterday also I shared, in my group, there are 30-40 teachers, regularly I am posting the message, this institute doesn't believe in 100% result, first thing. So whatever genuine result you are giving, 5, 10, 15 fail ho rahe, we are least bothered about that. But be genuine with that. And unofficially, all my departmental teachers know that you please indirectly convey, if you indulge into any immoral practices, we will replace you. That is very clear. And I am only deciding who will be the examiner in my department. So that liberty is with me. But it is not there with all institutes. The person who will be deciding will be somewhere different. So there are benefits of private universities also. If you want to have good practices, you have full authority to do that. But majority of the time, this authority will be misused by those persons for the shortcuts. Enhancing cultural competency and empathy. This is also important when we are dealing with our students, when we are dealing with our patients, correct? Because now we are a part of multicultural society. We cannot have the beliefs of only supporting one kind of culture, correct? So that's why this is also important. Creating a culture of integrity and professionalism. That is what we have been talking since almost last half an hour. Preparing for real world challenges. It is very easy to give 100% result, but that 100% result will make your students very weak. In long term, they will not be a very good, they won't survive, because in society it is very brutal. So if you make them strong with these kind of ethical practices, then only they are going to survive. Many times it happens that, say for example, somebody has appeared for applied for some job, then he will be calling his or her teachers, sir please phone kar do na, wo aane wala hai, isko phone kar do. I don't believe in this kind of. Till day, I have not called my guide. You just please call. Nahi. But wherever I go, he calls me. How are you? How is the interview? So that image you need to build up, isn't it? Because if you are, if my guide has made me that weak, every time it is his responsibility to give me a good job. But he was so harsh. I am talking about Dvedi sir. Very, like I have seen him 9 o'clock he'll enter. Like say in the afternoon also, in the department also, 2:30 he will be there. And he will be there till 6:30 by the time the discussion gets over. And say, for example, if you want to meet him, you have to go and tell him, sir, I want to meet him. The sequence the scholars will meet him, accordingly only he will meet you. If I have met him at 2:35, then I will be the first person to be called at 4 o'clock. If somebody has met at 2:37, he will be the second person. No partiality. So that kind of very highest ethical kind of standards he had set. So as it is told that a good teacher will, and that is for every profession, that with your heart, with your hand and with your brain, all these things should synchronously work. Then only, if only brain is working and hand is working, more malpractices will be there. Your heart is, if your heart is involved, then it is going to tell you what is right and what is wrong. And that is the reason why mana is in the, we believe that it is here, not here. Otherwise, there will be very difficult. Yes, ma'am.
How can we enhance the accountability and responsibility in students?
Say, ma'am, what I feel is, this one slide that I am going to show, that shlok is from Bhagavad Gita. Yadyad acharati sreshtaha. Whatever you will be doing, your students are going to follow the same thing. So if you want to make them more accountable, more responsible, they should see you for the next 4.5 years. You are the most trustworthy person, more accountable, more responsible. Because these things cannot be preached. The problem with ethics is it cannot be taught. That in the class you will ask somebody to sit and you are preaching for daily hammering for 1 hour, nobody will be ethical. The thing is that how he is born and brought up. And the mentors, the concept of mentors is for that only. When I say that 10 students will have a good mentor, if you are having those 10 students in your connection for the next 4.5 years, and if he sees that he is a very ethical person, then he will be accountable, he will be responsible. This is what I feel. Otherwise, there is no method to make him accountable or responsible. So the highest ethical standard needs to be set by the preceptors, then only. Now, yes, this slide. So when we talk about ethical practice, it is more, knowingly I have selected this picture because here you can see there is a very clear-cut demarcation. What is black and what is white. So when we talk about morality, it is about right and wrong. But morality has got certain limitations. When ethics, it is clear-cut written on paper, this is white, this is black, you are supposed to follow this, you are not supposed to follow this. Now, categories of ethical practices. This is only like I have compiled all the ethical practices in Samhita under different headings, and then we will be going to the references. Because I hope like whenever we will go through these ethical practices, they are somewhere related to some shlokas. Those references we will go through afterwards. Ethical principles for physicians, correct? Then ethical conduct in daily life. Physician, okay, 9 to 12, 2 to 5 when I am in OPD, okay, that is a very limited. But day-to-day life, what I am doing. Then ethical practices in clinical interaction, directly when I am dealing with the patients. Ethical practices towards society. I am a part of society. A good society cannot be created without good citizens. So if there are good citizens, then certainly there will be a good society. So, and ethics, self-ethics for Vaidya. This is more of connected to our references. Now, ethical principles for physicians, what is expected from us? Compassion towards all living beings. Treating all patients equally regardless of their caste, their wealth and social status. Not refusing treatment to a patient in need except in incurable cases where it is told that we are not supposed to deal with that. We are supposed to refer them. Avoiding greed in fees for treatment or recommendations. This is what which is going on. Cut practices. Avoid discrimination on the basis of religion, race or personal bias. I know certain physicians, they only prefer the patients of certain caste. His students are clearly instructed, if the patient of this caste, creed, community comes, send him to, because we are having multiple OPDs. Now, you send him, I'll not. Or otherwise, he will talk very harshly. So that kind of bias is with there. Whatever they might have born and brought up, whatever experiences they are having, they're very senior faculty, they are very senior and reputed kind of practitioners. But that bias is there. So that should not be there. Truthfulness in communication about prognosis and treatment. Multiple references are there in Chikitsa are there. In Indriyasthan 12th chapter deals about that. Then maintaining confidentiality. In Samhitas also direct references are there. Then avoiding misuse of knowledge for harmful or unethical purposes. I told you, majority of the unethical practices will be done by most of the best of the brains in the society. Correct? So that's why it is not expected. Practicing within one's competence. This is what I was talking about. If you are trained in that, if you are competent enough to do that, then it is ethical. But if you are not trained, and then also if you are indulging into that, then that is a severe breach of ethics. Avoiding intoxication. Various references in Samhitas are there, direct references in Samhitas. And remaining in a clear state of mind. Why? Because when a person is intoxicated, there will be moha. He will not be in a position to take what is right and what is wrong, that decision. And that's why this is important. Humility and politeness, because the patient is a patient who doesn't have patience. So we are supposed to have that patience. But unfortunately, sometimes due to lots of that burden, QCI is coming, NABH is coming, NAC is coming. And then the most important job of ours is our end user is our patient and our student. And that gets severely compromised with all this documentation. Continuous learning. Samhita also very param prayatnam atishtet. Because it is up to the physician. Param prayatnam atishtet, it is nothing but CME. That continuously, why these training programs are there? Because by the end of these 6 days, because like here, whatever resource persons are coming, you are all senior faculties also. Whatever we will be talking from this podium, you already know the fundamentals, correct? But this is only brushing up those things. So that this will be revised, and maybe if 5-7 take-home messages are there, and that can be implemented at your institute. Because the purpose of this training is that needs to be percolated at student level. Daily life, early rising, Brahme Murti Uttishtet. Following daily regimen, every year we teach Brahme Murti Uttishtet, whether we are waking up. So, because if I am not waking up, morally I am wrong to tell anybody to practice this. So now again everything, because throughout my presentation I am not going to blame anybody, only to me. Correct? Because when a thorough proper thinking is done, always mula is you only. And that's why Naishthiki Chikitsa will be talking in the next session that you should update yourself. Respecting elders, teachers, Arche Devgo, Vipravruddha, Vaidyan, Rupa, Atithin, highest kind of moral standards. Now there's a problem in the department. I do not have good relations with my associate, assistant, with my departmental colleagues. And here we are talking about Arche Devgo, Vipravruddha, Vaidya. So we should understand from where we have started and from where we have reached. Non-violence, yes. Truthfulness, control over senses repeatedly. Because they knew why Asatma Indriyartha Sanyog. Every time they will be talking about the main reason is. And nowadays also, whenever we feel that very strong breach is going on, somewhere only these 3 causes are there. Purity of body and mind. Repeatedly they are talking because physician is considered and teacher also. Throughout our Samhita, they never talk about the details about the qualities of the teacher. Only Vimanstan. There he talks about Acharya. Correct? Otherwise, throughout the Samhita, he only talks about Vaidya. So, highest moral standards, not only for physician, but also teacher. And we are fortunate enough that we are part of both these professions. Forgiveness, compassion, charity, avoiding excessive greed, yes, avoiding harsh speech, then containment, friendliness towards all beings. So, respect for others' property, various references will be going to see about that. Avoiding food obtained through improper means. Now food has been changed into money. Keeping promises, gratitude. For clinical, gaining patient trust. Jnana buddhi pradipena yona avishati tattvavid aturasya antaratmanam  Chikitsati. Highest standard until and unless you can touch to the soul of the patient. You're not supposed to treat him. With the 5 minutes of consultation, how I am supposed to teach the soul, touch the soul? So that needs to be taken care of. Consent, not abandoning a patient midway without reason. Avoiding unnecessary or harmful interventions which are not good for him or her. Avoiding sexual misconduct. Very higher standards are told. Okay, majority of the participants are female only. There are certain quotations about this where it is told Sriyam Avajani Sriyam dash dash. But I always see that is for both genders. It is not only for females. If you consider here as a male, the opposite, that kind of respect and everything should be there. Ensuring hygiene and safety. Then towards society, participating in public health measures. We are in part and parcel now. Educating people, and with now, as nobody was doing this, and that's why criteria 9 has been introduced in QCI. Because NCISM has got the norms to adopt 5 villages. Correct? How many of us were taking those villages? Only Swasthavritta department or NSS was taking. They will go for the camp, they will take the photos, done. Nobody was working in 5 villages. Now, with criteria 9 in Quality Council of India, they want everything is to be done in that adopted village. And if and only if it is adopted, then only they will consider your data. Otherwise, they are not. So that is your accountability towards society. Educating people about healthy living, again the same criteria 9. What kind of education programs you are taken for school kids or females or other thing. Avoiding actions that harm the environment. Now we are talking about here SDGs, Sustainable Development Goals. Best practices criteria 10. In best practices, institutes are coming with very nonsense, the most worst data I have seen since last 2 years. I have visited almost 10 institutes for QCI. The worst data we get in criteria 10. The institutes still have not understood what is best practices. Only 2 purposes. How you are beneficial to your students and how your practices are beneficial to your society. So here we are talking about that, how you are beneficial to them. Teaching deserving students without discrimination. Correct? So there shouldn't be, now there is no selection criteria as madam was talking about. The students are not interested. Now discrimination is going on. The person is not interested in Ayurveda, then also he has taken admission in Ayurveda. Now you are supposed to teach him from first year only, he is not interested in your talk. Protecting animals used for medicinal purposes for various, now we all know Animal Ethics Committee, their rules and regulation. Promoting peace and harmony in the community. So how the institute is playing the role as a teacher, as an educator and as a physician, we are accountable for that. For Vaidya, regular medication, this is too personalized. And self-reflection, this is going towards Naishthiki. Avoiding arrogance due to knowledge and skill. Pravrutti, in Pravrutti one is Ahankar. I have this much knowledge, I have this much degree, I have delivered. What I feel is actually this introduction of any resource person needs to be stopped. Because it provides food to the ego of resource person. Very good. And I have come across with some resource person, they feel very bad if you do not read his or her CV completely. So this needs to be stopped actually. This is not good if you are practicing Naishthiki Chikitsa. Maintaining a sattvic lifestyle. Following a disciplined daily and seasonal regimen, refraining from practices when physically and mentally. There are stages. Throughout your life, you cannot be mentally and physically fit. Whenever it is getting compromised, some help is to be taken. There's nothing wrong in that. Avoiding involvement in unethical business, straightforward, directly, we should stay away from that. Being a role model in personal conduct for society. You need to, if you are a role model in your institute, you have achieved 50% mark. If your student feel, because many times we get those remarks from that, sir, very good. Then I ask him why I am good, you tell me. So then I'll come to know. I don't know, how many times you take the feedback from your students? Huh? Huh?
In the profession, 3 times.
3 times. That is very good practice. I have started that since 2006 when I started. Institute takes the feedback, but I'll take mine. First, I was taking only mine. Then when I become HOD, I am also taking the feedback of all my faculties. After taking those feedbacks, I'll read. Wherever those red lines are there, red marks are there, I'll put red, just underline, and I'll give those papers, because in the same paper, they'll be sentenced to me there'll be sentences to my co-colleagues. But all those, whatever 100, 150 pages, I'll give to my colleagues also. You read. If they have written something good about me, then try to follow that. If for other colleagues, something good has been written, though I am having 20 years of teaching experience, but yes, still learning should be continuous. Correct? So that's why, if you want to become a student, should feel that, okay, he or she is a role model. Correct? And that is not possible by being a popular teacher. You need to be very harsh. Correct? When it comes to discipline. You need to be very harsh when you are taking examination. Not to fail them or to do unethical practices, but to make sure that you will be a very good practitioner and citizen. Now, ethical practices mentioned in Ayurveda. How much time I have? 10-15 minutes. So I feel I'll not go into the detail of the references because you already know the references. We'll just, so last few slides are there. Social conduct, correct? Why I have taken this from Ashtanga Hridaya first, because there you will find everything at one place. In Charak Samhita and Sushruta Samhita, you need to go through whole Samhita. Then Naika Sukhi na Sarvatra na Shabdo na cha Shankita. Like very highest kind of standard. And I always feel like whenever I teach these chapters, I ask them, you just write this and stick a paper in your room and just daily introspect how much that this is the benchmark. This is the highest standard which is set by our ancestors. If you can reach that, that is extremely good. But daily introspection, weekly introspection is needed where I am lacking and gradually upgrade ourselves. Then Brahmacharya, Dana, it's Madhya Vikraya, this is clear cut that like intoxication, even supporting that indirectly, that needs to be avoided. Ardra Santanta, Tyagha, Kaivak, Cheta Samdama, Swartha Buddhi Parartheshu. Now everybody is becoming selfish. Here it is told you should be selfish, but in others' work, not in your work. Then Bhaktya Kalyana Mitrani, this all, Insaste Anyatha Kam, Dashvidha Papa Karma, these are all, if we start practicing this, gradually the person will become a good person. Then activities, yes, whole Sadvrutta chapter is related to what is to be done and what is to be avoided. We do not have that much time, but beautiful. Even commentary also have taken the references. All Daksha, Kshamavan, Dharmika. And unfortunately, nobody teaches this chapter word to word. That is good. Because I feel that, okay, this is very good. Now, this is because we are having adult learners. And now we have a concept of self-directed learning. So this is all I cannot tell my student that, okay, Daksha. He can understand, they're all adult learners, they immediately understand what is written. But why this is written, why this is to be done, and why this is not to be done, it is not written in Samhitas. There, the role of the teacher comes where we should contribute. Then, yes, na anrutam bruyat, etc. This, now, yes, lot of all that female power will be like contradicting why this is written. So, yes, that's why this is for both genders. Na sato na gurun parivadet. Then, nati samay jayat. What a beautiful quotation. You should not waste time. That is what we are talking about. Not for viewers as well as for students. So, if half an hour you are talking and discussing nonsense with your students, this ethics is getting compromised. Nati samayam jayat. But unfortunately, our students are not telling us, sir, nati samayam jayat. Please stop this. They feel that in Viva it will be very difficult. So, and most important, what I feel is, being a teacher, our student should have the liberty to say whatever he or she feels, to convey. If she is under pressure that it will be difficult for me in Viva, it will be difficult for in exam, then I am not a good teacher. They should be free to tell me that, sir, please stop here. Then, न कार्य कालम अतिपात है, न अपरिक्षितम अभिनिवेद, न इंद्रिय वशकासात. Achar Rasayan, again the best kind of standards. And now everybody is talking, after COVID, everybody is talking about Chavanprash, Rasayan, but nobody is talking about this line. Gunai retai samuditahi. Until and unless you practice Achar Rasayan, actually you are not eligible to take Chavanprash. So first you do this, 50% of the population will stop taking Chavanprash instead of following this. Because this is very tough. Taking Chavanprash in the morning is very easy, but who will tell this? Correct? So as a part of the society, we need to educate our patients that, okay, these are the standards. If you want to get maximum benefits, then only, like we are supposed to follow this. Then related to Vaidya, multiple shlokas are there. I think we can skip these things. And yes, all these shlokas we are going to see in next presentation, Naishthiki Chikitsa. Because Naishthiki Chikitsa, when they are talking about pravrutti and nivrutti, pravrutti is something that we should not indulge into. So everything is not to be done. So it is varja sevyashanara. This is what they have told. So the preparation for Naishthiki Chikitsa starts from Sutrasthan. Directly they will be dealing with Naishthiki Chikitsa in Sharistan. But the base they have already prepared from Sutrasthan. Based again standard, Maitri, Karunya, Marteshu. Shakya Pritihi, that is very important to selection of the patient. Indriya Sthan is there. Where to stop? Sadhya Vibhaga, Kale Charabhati Karma. Then, yes, many references are there because when we are talking about that competency, so here they are talking about that competency. Bishaja Prak Pariksha Evam, because as a competent physician, proper examination needs to be done, then only you should start the treatment. And if it is not followed, that is the most important unethical practice. Bishak Chadmachara, all these Vaidyas, they are the best example that what needs to be avoided. This is again best ethics, correct? Because we are going to come across with patients where they do not have that much money to do those panchakarma. Now day by day panchakarma is going beyond the reach of middle class also. You just imagine yourself that if you want to do, lots of money needs to be spent. And if you are going for a government institution, then there's a lot of like a waiting list is there. Then I was at one of the very reputed colleges. I was just taking the round for QCI. One patient came. She was very educated. Sir, this is what going on. She has lots of complaints. I said, what is happening? She said, sir, nothing is ethical here. The beds are not, the sheets are not changed for panchakarma. She was very elite family. And the college was located in a very elite class. That's a government institution. She was not at all happy about the practices, what the masters are doing. This is the problem with government institution. And private, they are charging the money like anything. So, what now, like when we are talking about Ayurveda needs to be reached to the class that is where the socio-economic, they are coming from the lowest kind of slot, then these are the standards that they have set. Okay, whatever resources are available, you do with that. Let me tell you example. When I was practicing at PT Joshi sir in Dhule, when I was doing my UG, that time we used to give basti in 10 rupees. How we used to give Niro basti? Correct? First the patient will be done Snehan Swedan. For Swedan, in that cooker, Dashmul was kept. It will be boiled. Swedan is done. Now that water is there. That water needs to be filtered. That 400 ml of water and 100 ml of sesame oil. And we are getting good results. Because that doctor was for an ordinary person. He was not a very light client doctor. Because in market there are that time also I am talking about 2000. 2001, 2002, that time within 10 rupees and still very at the lowest cost they are providing panchakarma. Because if now ethics says, Makshikam, Lavanam, Kalkam, Kotham, I am having 50 patients, 70 patients in the morning, to prepare one basti, it takes at least half an hour. Makshikam, Lavanam, Kalkam, Kotham, and the cost will be very high. If ethically, if you are practicing. But now if the patient is of very, I have two options. Ethically, I should say, no, you don't have money, you go. But my morality says, let us compromise in the ethics. I can give at least somewhat result with this kind of practices. So that's why I told you, ethics is very good. But sometimes that dilemma is always there. Now the physician has to take the call. Where they have to follow the ethics and where they have to stop at morals. Yes, this is again, there's nothing wrong in naming the disease. You don't know because it is unethical. If you don't know anything about the disease and then also you are treating. But here directly they have told Anukta Vyadhi concept, Trivida Bodhya Sangra. If you don't know anything, there is nothing wrong. Just 2-3 things you know and at least you can start the treatment. Again, this one, Rogamar, this is the sequence. Pranabhisar, this is whole summary is there from Sutrasthan, Pranabhisar and Rogabhisar. Chadma Bishach, they have given the details here only. Then, yeah, this is for education from Vimanstan. High standards for student. Now, unfortunately, we do not have the right to select a student, and even the student doesn't have the right to select a teacher. If there are 50 teachers in the institute, everybody knows there are few teachers who are not eligible to become a teacher also. But they are teachers, but for 30 years, they are going to set the best examples of unethical practices. Correct? So, here it is told that what kind of teacher is best, what kind of student is best. But unfortunately, this all is gone now. There are still good institutes who will do a proper background check. Do you know about antecedents? What is antecedents? In NIBH, there's one criteria when any staff from class 1 to class 4 is to be appointed, antecedents report is to be taken. What is antecedents report? Crime report. From wherever he is staying, from that police station, a report has to be created. Online also it is done now. If you have got any criminal cases, you cannot be appointed as a watchman. You cannot be appointed as a class 4. These are the highest ethical standards. So now day by day, we know what are the loopholes in the system and government is coming up the norms. But how many institutions, say for example, if you are a government employee, there will be police verification before you join. If that is not proper, you will not going to get the job. But that is not followed in other institutions. But again, what about other institutions? Every state will have only 4 or 5 government colleges. What about rest of the 45? Because when we are dealing with the patients, we are supposed to have those individuals who are morally very good, who are not criminals. So here, all these conditions, per hour of Vaidya Pariksha, they have told that what is good and what is bad. Then again, the same has been continued. Yes, this I was talking about, Vimanstan. No avishya aturasya antanatmanam nasa rogansh chikitsati. That's a very basic criteria. So it says that every doctor needs to be a very good communicator. If the patient, one of my senior who is working at Ayya, he used to tell us that Ayurvedic clinics are emotional outlets. Because nobody is going to give that much time in allopathic setup. So they will be coming to Ayurveda practitioners, they will be talking a lot, they will open up with the emotions, and that certainly helps them, or rather us, to give proper treatment. Then Ature Vaidyasya Kartavyam, what needs to be done, what we should avoid. This is what Atma Bandhavan Eva, higher standard. Then this is about from Samhita. Not only theory is important, you should be equally clinical skills, and this is what because government also knew Ayurvedic doctors are getting degree, but they are not having skills, and that's why the whole concept of competency-based syllabus, because both are required. Then yes, Shastra, say for example, he needs to have that courage. That is also a moral value, important, because in surgery, if he is sweating or perspiring like anything, there is a fear, and fear comes from incompetency. If you are not that much confident in doing that kind of surgery, there is your nervous system is going to work hard and you will be perspirating. So these are the standards that they have set. They have not told that this is ethical practice. But when they are saying asvedam, it means you should have that confidence and shaurya. Then who should indulge into chikitsa, all these things. Yeah, ethics in emergency. This is also very good reference in Samhita. Na ichet vidim, because this chapter talks about purva karma, pradhan karma, paschat karma, but it is for a regular patient. In case of emergency, you can bypass the whole protocol and you only directly focus on the life of that individual. Because ideally, whenever a surgery is done, all those reports, pre-anesthetic checkup is to be done, pre-operative, during, then post-operative. But in emergency, all these things can be bypassed. So here, ethics says you should not do it. The protocol needs to be followed. But in protocol following, the patient may die. He might be a patient of cardiac arrest. So bypass the protocol, directly treatment. So though our Shastra is talking lot about ethics, but somewhere they only will tell that, in Charak Samhita there are certain references now where he says, okay, you can bypass this. Ultimately, you are there, you are seeing the patients. So don't do what I have told. Yasyam karyam akaryam sat karma karyam cha varjitam. After writing the whole chapter, that is ethical. That do woman in this patient, do not do woman in this patient. But at the end, yasyam karyam akaryam, everything becomes big zero. You only the right person to decide. So that is morality. And yes, this is again important. Now everybody is practicing for Vrityartham, except we teacher. Because our bread and butter is not attached to that, we cannot expect the same kind of ethical practices who is a private practitioners who has just started his practice. So somewhere he is going to compromise for finance purpose. But that time, na vrityartham. Then yes, again, base kind of standards. Why it is told? Vidya samapto. Dvija. Here it says, Vidya samapto brahmam va sattvam arsham. We all know that Brahma and Vishisattva, that is the highest kind of emotional, we can say, benchmarks which are set there in Manasik Prakruti. So whenever a physician or whenever a doctor or student completes his education, he is supposed to have this kind of Manasik Prakruti. Then only he will be a very good doctor. And here also, this is also important. And this is related to my next presentation also. What he is telling? Two options are there. Commentators are beautiful. What they tell? Brahmamo arshamo iti vikalpo. Because it is the ethical principle of any commentator that he has to support the main author. He rarely contradicts. So what he does? Okay, Brahmam va sattvam. Na? So you tell me whether I should follow Brahma or Arsha. Then he says, Tayoryo Naishthiki Chikitsa artha tasya Brahman. If you are talking about a Chikitsa for Naishtiki purpose, permanent liberation from all kind of miseries, then that sattva should be there. But itarasya to lokanugrahina arshamiti. If you want to become a very good practitioner, you can restrict yourself to arsham only. So again, best kind of standards. Concept of limitation in the practice. Throughout Charak Samhita, we come across with these shlokas. I should know my limitations. This is the place where I need to stop. Then Adhyayan, this I'll skip. For students and teachers, you already know. Yeah, this is important. Sir, I'll take 5 minutes only. Ethics, Ayurveda and contemporary medical. So tried to compile both and tried to compare them actually. So here if you see, is a domain of where these references are. For Ayurveda, our references lies in all our Samhitas. But for others, they don't have Samhita. So Hippocratic Oath, Declaration of Geneva, Nuremberg, Belmont Report, everything. Correct? Then purpose of medicine, we both of us, allopathic or Ayurveda, we both have us having the same kind of standards, Swasthasya Swastharakshanam as well as Aturasya Vyadhi. Then physicians conduct, here it is told, truthful, compassionate, here also professional. We all know that when we got our registration, every registration board is set to, is supposed to send a 2-3 pages document that what are the best kind of ethical practices. That when I am sitting in my OPD, I should not criticize other doctors. That is the ethical practice. The same is applicable for teacher. I cannot criticize other teachers sitting in my class. Correct? So professionalism, honesty, integrity, avoidance of conflicts of interest. Then patient care, yes, treat all without discrimination. The same is also here. Correct? So a science which is told 5,000 years back, and the science which is popular now, you see, both of the things are almost at par we are going. Confidentiality. Charak Samhita direct reference is there. We should not share the details with others about the patient. The same confidentiality is here. Various norms are there, very clear cut, more defined rather than Ayurveda. That's an advanced version of which is written in Ayurveda. Then consent, yes, indirect references are there. In modern direct, now multiple consents are there. Right? For general consent will be there, then procedure consent will be there, then surgery pre-anesthetic consent will be there, HIV consent will be there. So it means there should be transparency when we are dealing with our patients. Then all these points like beneficiaries or non-beneficiaries, almost you can see the same kind of principles are there. So though both the branches are different, but as we are dealing with the patients, the ethical standards are almost same. And we must know that when these standards are set, they were not knowing anything about this. They didn't read any of the Samhitas. So, but as they were ethically good people, morally good people, and that's why these conclusions are there. Then, justice and fairness, same you will find here. Professional fees, the same kind of guidelines are there. Research and experimentation, more guidelines will follow in because more advanced kind of guidelines are available now. Teaching and mentorship, respect for gurus, only deserving moral students should be taught. Clearly told. Those who doesn't deserve, we are not supposed to teach, but now we do not have the option. Whosoever sits in the class, we are supposed to train them. End of life care, public health, spiritual and moral dimension. So all these things were there, and yes, these are the things like we have seen in previous slide also. For this purpose only, being a teacher, being in any profession, these kind of higher standards we are supposed to set. Why? Because it ensures that the physician is not only a skilled clinician. What is important is you must have excellent skills, but you need to have moral responsibility. If you are a good person, then you can become a good doctor, you can become a good teacher. If you are a skilled person, I am not sure whether you are good or not. Correct? So yes, respects life, upholds dignity, protects confidentiality, practices with compassion. So this is which is expected. And yes, at last few shlokas, Shastram Jyoti Prakashartham Darshanam Buddhiratmanaha. So yes, buddhi is required, Adhyavasayo buddhi. So buddhi is nothing but ethical practices, what is right and what is wrong. If it is a subuddhi, then chikitsam na aparadhyati. But if it is a kubuddhi, then always chikitsam aparadhyati. So that's why ultimately he is telling that again we need to, that's why in my next presentation we will be talking about Sattva Shuddhi. More of. Now, and why now in 21st century moral education is needed? Previously it was there, but 21st century it is most important. Ethical compass in a fast changing world. The main role of compass is to show the direction. If the person is properly trained for ethical values or morality, whatever situation he is going to face in the life, that compass is going to guide him and always he will be selecting what is right for the society. Then what is right and wrong? Preserving human values with technology. Because now with lot of technology, again moral ethics are getting severely compromised. All those hackers and everything. So yes, now that's why moral education helps to develop digital ethics. Now every field we need to have ethics. None of the professions are going to survive without ethical practices. Building character and emotional intelligence, most important thing. Whenever we are in touch with our students, one thing or one message needs to be clearly conveyed, that this 4.5 years is not only to achieve the skills, not only take the knowledge, but use these 4.5 years to build up your character. Correct? And for that, we should be the role model. Somebody should be in the college to whom he or she can look up to, because that is the very tender age where they need some kind of guidance. Sure. And again, yes, honesty, compassion, and then only social harmony is possible. In society, there's a lot of whatever which is going on around us. It shows somewhere ethics are getting compromised. So tolerance, respect, non-violence. Then counteracting from Ayurveda, I felt I should stop here only. Because whenever they have wrote this Samhita, already they have done a lot of compilation. So yes, this I feel very good. Yadyad acharti sreshtaha. So when we are talking about responsibility, when we are talking about morality, we need to set these principles on our own. Then only tad eva itaro jana. If you feel that your students are supposed to have those best kind of ethical standards, then first again, as I told you since beginning, I need to set those standards. Correct? If I'll stop here, my students can go to this level. But somewhere introspection is needed. Yes, one of my assistant professors, she has helped me to collect all of these references. So it will be very unethical if I don't share her name, because she only has shared me. I have told her, okay, you collect these references and commentary. So she collected everything. Few of the references I have collected. So wherever you will find written Chakrapani completely, she has given. Where CK is, that is my short form for Chakrapani. In next presentation also. So she has helped me to collect all those references from Samhita. So she deserves. And also, sir, for providing me the opportunity. After this also we'll be talking about Naishthiki Chikitsa. Yes, this is again one of the very important shlokas that I like from Charak Samhita. Patra apekshini. So patra can be supatra and kupatra. But supatra can only be possible if we believe what is written in our Samhita, and that is ethical practices. If we start following that, certainly he will be supatra, and then we should not worry about, and that's why it is not pragyam chikitsartham vishodayat. It's a continuous process. Continuous lifelong learning is there. With our experiences also, we are going to learn many things. So this was all about this presentation. Thank you very much for your patient listening.
What is negative feedback and critiquing? Are they both the same or something else? Like when we
Can you give one example of negative feedback?
So like if we want to improve ourselves,
Huh.
means when it was in the context when we take something from students, like feedback what we
Correct.
means ourselves. And we usually, means I personally usually tell them, don't give a positive
Correct.
feedback. Give
Correct.
something negative so that I can improve myself in the next class or in the
Correct.
next session.
Correct.
So what is critiquing or criticism and this negative feedback?
Okay, fine. Negative will be one part of critical analysis. Critical analysis, let me give you one example now. Do I have? Okay. So, here almost there are, I came to know that there are 5 to 6 persons who are part of SA1 committee. Sir was the coordinator when SA1 syllabus was designed. Correct? Myself is there, Sarvesh is also there, and also Shrivas sir, who is from here. So, like when this syllabus was designed, he knows how many meetings we have conducted, how this syllabus was designed. We were forced to eliminate Ashtanga Hridayam. Correct? The standard guideline was remove Ashtanga Hridaya, bring Charak Samhita only. Only one Samhita needs to be taught from first year to final year. Okay? Then I took the responsibility. I did some critical analysis. If you remember, I prepared a 2-page document that how Charak Samhita is very good, but it cannot be taught to a student who is coming from 10+2 background. And why Ashtanga Hridayam is good. So those 10-page, so 2 to 3-page document I shared in the group. Our chairman was A.S. Bagel sir. Then that was sent to, that time it was not NCISM, that time it was a governing council was there. It was discussed in governing council also when sir and sir was, they were chairman and co-chairman. And we strongly put then also for we started our work from, if I'm not wrong, September 2020. And for the next 2 to 3 months, by the time all first year syllabus was designed, Samhita people as usual only discussing what is to keep and what is to remove. We were like struggling, we want to keep Ashtanga Hridaya, and they were telling you remove. Then ultimately the whole committee conveyed, we are not going to remove Ashtanga Hridaya, you better change the committee. You better change, because giving this kind of statement is not good, because if you are giving this kind of statement, you will be removed from SA2. I was removed from SA2. But then got back in SA3 also. So that is a critical analysis. So why I am telling that? So you need to give both aspects, positive as well as negative. And when you are telling me that when you take the feedback for positive and negative, I'll say take both the feedbacks. Because sometimes motivation is also required. And why? Because, for example, when you are taking the feedback from everybody, for all departmental faculty, there might be some best practices that my assistant professor might be doing. I don't know that. Because he is trained in a very advanced, I did my post-graduation from 2001 to 2004. He did in 2011 to 14. So there is a chance that he might be having some advanced kind of practices, or he might have learned some good practices from his teacher. So if the students are giving positive as well as negative feedback, this is for whole, we almost, in my college, my department is the only department where I take meetings at least 4 times a week. I'll be sitting with them at any time, 15 minutes, 20 minutes. Weekly, Friday, we have a meeting of 1 hour to schedule everything. But anytime we can have 15 to 20 minutes. If everybody is free, we will have the discussion. Because with new syllabus, with multiple subjects, many times this right, wrong, what has to be done, what has not to be done, that needs to be discussed. But if you are taking both the feedbacks, it motivates others. What positive, I know. But something good, which is felt by my students, other faculties may follow. So when we are talking about negative feedback, it is only 50% of critical analysis. Critical analysis needs to have both aspects, positive as well as negative, and both are needed. If, say, for example, 2 years you are only getting negative feedback, anybody will be demoralized. That I am giving so much, and with this so much syllabus and documentation, still I am getting negative feedback. And many times what happens that once, one of my faculty got very bad feedback. Out of 100 students, 80, 90 students gave only negative. What he is doing, this thing, this thing, this thing. Everybody read that. I told, don't worry, this will be with me only. But try to find out the ways to address. Consider this only areas of improvement. He was assistant professor. But now after 2 years, I can say only 10% complaints are there. But it needs to be conveyed, and it needs to be conveyed positively. If being a HOD, every time I get a chance and I'll bang him. No. this, then he is not going to improve. If
things should be taken as
positively. And if they see that, okay, say for example, let me tell you, you might have also observed, I am a Vata Kapha predominant Prakriti. So my speed is comparatively, for teachers, it becomes very easy. But for students, and that to first year BMS students, sometimes they face, because my space, because I am playing on this field since last 20 years. They are coming, first time they have come to bat on this field. So sometimes they face it very difficult. So whenever I go for such kind of presentation, every 10, 15 minutes, 30 minutes, I remind myself, cool down. Cool down. Then only my pace will be reduced. So, okay, I know, but at least if they are writing this, then my other faculty members should feel, yes, they are giving some negative feedback about HODs, and HODs are also taking it positively. If, for example, 2-3 students have, say 5-7 students have written, because names are not there, roll numbers are not there, it is easy to track with handwriting, but we don't do that nonsense kind of thing. But if, and everybody, if they have written something good, something bad about me, everybody, we will sit together. First, I will go through those papers, I will underline what is negative and what is positive, both the things for everybody. It takes for me almost 2 to 3 days to go through all feedbacks. Then that will be handed over to my associate. 2 associates are there. Then 2 assistants are there. All 5 of us will sit together after that. After reading, then I'll discuss, okay, what is good about you? What is good about you? What is bad? First, we'll be talking about what is good, so that everybody can start doing that. Then we'll be talking about negative. But for negative, I'll leave it to them. That you make sure that how it can be addressed. If you want any kind of assistance, I have got 20 years of experience, this is the way it can be done. I am doing this. If you feel it is good, you follow. Otherwise, you can have your own methods. So this is what. So critical analysis is good. And I am very good at critical analysis. Anything else?
To get that feedback, whether
No, I have, it's an open question. Because what happens if I am giving only those 10, 15 Google, they will be only thinking about that. But there are areas, for example, in my feedback, I will not write that I teach very fast. That comes only from their side. So that is the problem with closed questions. So it should always be open. Or you can have a blended kind of version. You can have a Google form, and after that, a page they can write. Whatever you feel, good, bad, anything you want to write, you write an essay. I'll give them half an hour if they are writing. Because that exercise is done every 6 months. And most important, whatever feedbacks are there, whatever the conclusions are there, we'll make sure that they are implemented in the next 6 months. So whosoever has given the feedback, he should feel that whatever I have written, these people have taken it seriously. Because every year I am taking the feedback, every year I am getting the same feedback, and if no improvement is being done, the seniors are going to tell the students, nothing is going to happen, this is only formality, nobody reads, you do whatever you want to write. So there is no fun in taking such kind of feedbacks. So open, that is what I feel. Anything else? Or you want to share your experiences maybe? Yes, ma'am.
This is out of the topic. So we don't have a feedback just because the feedback came. From NCISM, like how are we implementing the NCISM syllabus for the students? There is no portal where we can give a feedback to NCISM.
That is what we are coming for QC, Anna.
Sir, but
Because whatever is syllabus, if you see MSc 2022, and if you keep it along with your this QCI framework, whatever they have written, they are checking it. So, like when you are getting a QCI feedback, correct? 100% you know. For example,
because especially what we feel is the way of teaching Samhita is kind of restricted.
correct.
Like we do like some points are to be like because the students even know the syllabus.
Correct.
They're like this is not must to know, this is desirable to know, this is nice to know. When we don't teach according to the time frame what they have given, when
Correct.
we teach that we have to follow the pattern what NCSM has given. But when we follow that pattern in some other topic, when we want to relate to this subject, but it is not taught there.
Correct.
There is a missing link of connections.
Correct. So now let me share
How do we address that?
2 experiences with you, because I am a part of syllabus committee in 2016, then 2020, and again 24-25. In 2016, there was a workshop at Jamnagar. It was a 3 days workshop. We did our work. Everybody submitted their syllabus. Then after almost 3 o'clock or 4 o'clock, I'm not sure whether you might be aware about Gurdeep Singh sir. Do you know? You know him. He was a faculty dean of Ayurveda at IPGT and RA. He's a BHU alumni. Very extraordinary person. Because BHU alumni, that's why he has very good command on modern side. And simultaneously the same kind of, because he is trained with CP Shukla sir. So he has got a very balanced kind of view. And he was at Hassan for a very long time. That's why you might be correct. So after doing everything, then we were sitting this very good. Everybody was happy. Because if you're a part of committee, then it's you feel that, okay, you have done your work very seriously. But at ground, we know what happens actually. So after meeting, he said, आपको जो बनाना है बनाओ, जिसको जो पढ़ाना है वो वही पढ़ाएगा. Nobody reads your syllabus. That was the statement in the concluding meeting. Because he is so senior, he has seen the syllabus committees for 30 years. And he felt that whatever vision syllabus committee prepares it, that vision is not percolated at the ground level. Whatever may be the reason. The biggest might be scarcity of the staff, scarcity of the infrastructure, time, all these things are there. So like what we are doing with this syllabus, say for example, essay 2. Now essay 2, when you go through the syllabus, there are many important topics which are skipped. Don't skip it. You can go beyond your syllabus. So whatever syllabus is prepared, that is only a guideline. Correct? If you feel that something is very important, please you must teach it. And say for example, if it is one lecture is required, if you are 2 lecture, on paper you can manipulate. Now here it is unethical, but my morality says you should do it.
We do that. It is not that we skip it, we just do it according to our time frame and we do it.
Correct.
But the thing is, when asking the question, it is already given. Like
Okay. Now let me share one more. Because this first time, and I was the first person to raise this to Mohan Joshi sir. When the syllabus was designed, because when the syllabus was designed, nobody was asked about the TT1 and TT2 syllabus. That was directly done by them only. The problem with TT1 and TT2 is we are asked to draw a question paper of 100 marks. Correct? All of you might be facing the problem. The syllabus is so little and getting MCQs, SAQs, LAQs from that pattern which is at the end, that blueprint, don't follow that blueprint. Because if you follow that blueprint, you will not be able to draw. So what standard guideline we have given to our student, this blueprint is only for university exam. For TT1 and TT2, we will go beyond that.
So even for the university, I'll just give you an example. Last year in Andhra Pradesh University, there was this problem with Rohini Rana and RSBK question papers. Just because one question, from the same syllabus, there were 2 questions asked, which were not supposed to be asked, but
Correct.
Both were important topics. One was asked for long answer and one was for short answer. The students raised a complaint to university telling that it is not according to NCI.
Then I am a student because that is ethical. Because TT1, T2, I will be with you. But when the problem with teachers, and that too I am talking about senior teachers, please don't mind. Because I am also part of that community now. Correct? The problem with is we are not changing, we are not taking that blueprint seriously. Because students have been asked to go through that syllabus repeatedly. Now they have prepared accordingly that blueprint. So ethically we are supposed to follow that blueprint. Though it is important when you are told, because this syllabus was designed by us only. That committee has only decided that this is the important topic, give weightage for 10 marks, 5 marks, 1 mark. When you will be part of that committee, you change it. But by the time you don't reach that level, you should follow what is written. So when students are telling, the same problem was happened at institute also. Even essay 2, I think. Immediately they came with the complaints. Then we said, okay, leave it. The problem with me is that we make sure at private university, we will not be drawing the question paper for our students. I make sure that both my evaluators, question paper, Viva, only Viva internal examiner is required. Otherwise, all 4-5 examiners will not be from institute. That is the ethical practice and that we are following. But the problem with other teachers is that they will not take it seriously because the way they have been taught that topic, and they might be morally correct that this topic is important, but whosoever has designed, now what is ethics? Ethics is written norm. And when it is written that is not important or that is for 5 marks, I am supposed to follow that. So that's why I said okay, I'll be with students. Because we need to change it. We need to change it.
So, but
Even not only that, many times Samhita teacher used to ask the question from Ashtang Sangra. Very senior teachers, they don't know, now the syllabus has changed, Ashtang Hridaya is there. So now this is unethical, na? Though it is for 2 marks, but that is unethical.
but the way we have learned from our undergraduation, even we had 1.5 years, but we learned it.
Correct.
Is it because Patel, like there is Dharma Rasa, there is Ayu Rasa, and there is syllabus?
Correct. Mati Rasa.
Is it adoptable to the present day?
It is adoptable, but the problem is that, because ma'am, what happens? Here there are 30. Only 5-7 experts will be shortlisted. Even the criteria of shortlisting, there's a big question mark on that, many times. Correct? Many times we come across with committee members and we feel, kahan se aa gaye ye log? Hai na? But theek now there are certain things that are beyond our control, but when you are a part of that committee, we should make sure, we were there together. We made sure that only that syllabus should come out, that what we felt is correct. Even Sarvesh was there. That time he was a PG scholar. That time it was a very good criteria to have PG scholars in the committee. This time they have removed this. Now only assistant, associate and professors were there in SA3 syllabus. Because we need to take the opinion from students also, PG scholar, that what is at ground which is happening. So whosoever sits there, they will design the syllabus as per their understanding. So I'll not consider it as unethical, but whatever they have designed, we are supposed to follow it. But yes, I told now some manipulations can be done from our side at ground level. But what I tell them, okay, this is very important topic. For example, let me now share Sharistan first chapter. Very important. Vimansan 8th chapter, very important. How many classes are there? Now it's very challenging to finish that chapter. I taught Sharistan first chapter for 8 classes. For 8 classes. But I told nothing is important for exam. Just listen it, and at least you should know that something higher standards are there in Samhitas. Otherwise, nobody is, because when we talk about Charak Samhita, how Charak Samhita separate or can be separated from Sushru Samhita, only Sharistan first chapter, Sharistan 4th chapter, Sharistan 5th chapter. Otherwise, the rest of the contents are, if you leave surgery and medicine, otherwise everything is same, na? So that needs to be conveyed. So as a teacher, I'll convey it, and simultaneously I'll make sure that on paper it should be Madhyamo Marga. Bhagvat says, na? He was more practical.
And one more of this thing, this is just my thought, like the way the syllabus is framed, S1, SA1, SA2, SA3, okay, that's fine, we can adopt it. But at the end of the day, when the Samhitas call, when the postgraduate students have to come for the Samhita, like only in the 3rd year they will think about post-graduation.
Correct.
But when they look at the 3rd year syllabus, where we can influence them more, like there is no chance to influence them at all because everything is so limited.
Okay, like
SA3 is like we see Jwara for only 1 class, Rasayana Vajikana for 1 class.
now there is nobody for SA3 committee from here. So let us, we can talk afterwards, maybe lunch and everything. I'll give the details, how the syllabus has been designed. That's a big story. Big story. But what I told you, Madhyamo Marga, you follow so you should be between morals and ethics. Beech mein raho.
SA3 we cannot.
50 hours is given and it's 150 hours.
Correct. I think we should, like sir is already here, but I'll be happy to talk because I was a part of that committee. I'll share the story with you, maybe in the next. Thank you. Thank you.
So afternoon also sir will tell you. So if we are framing something means it is because of, if wrong things will be framed by the subject expert committee means it is because of the higher authority.
Because now, listen, when you will be, that's why it was there, ki remove Ashtang Hridaya and keep Charak Samhita. Now for everything there are advantages and disadvantages. If you are practicing Ashtang Hridaya, then you will believe that that is the best book. Huh? I'll not debate about that now. Because that can be because I told I am very good at critical analysis, but let us not have. Somewhere at some place we'll discuss about that. But like whatever we are trained with, we should practice that. Then today morning only I decided, let us not keep this, we will keep it maybe pre-lunch. So anyhow you will be awake for pre-lunch, so this won't be that much heavy. Even like when I was preparing PPT for this presentation, it was difficult for me. because you need to have a lot of reading other than Ayurveda. Because this is something, because except Charak Samhita, nobody has talked about, rather nobody has dared to talk about this. Because every time when it comes to surgery, he will say Dhanvantaryanam Adhikaraha. But when for these topics, even you can see Vagbhat, you can see Sushtu Samhita or even other Samhitas, nobody has dared to touch this topic. Silent, everybody has, maybe they didn't expect Ayurveda doctors to have moksha. So they want us to be here and treat the patients for next few births. So they have, for keeping surgeries and everything. So nobody has talked about this. Now, like for Naishthiki Chikitsa, I had a discussion with Srivas sir also. Like, sir, what kind of things we need to talk to teach us? Because when we are talking about Sharistan, because majority of the references we'll get from Sharistan. At few places in Sutrastan, not only Charak Samhita, but Atreya Punarvasu or others, commentators have tried to link those words to moksha and the practices which are related to moksha. So as I was telling in the morning session, an attempt has been made from Sutrastan to create a base. So because directly you cannot introduce this topic in Sutrastan. It will be again very guru for a student to have this kind of topic. And what I feel, the last slide that I'll show for this presentation, even like we have been reading everything related to this from our UG days, then post-graduation, maybe if your topic is related to somewhat nearby in PhD, and in our teaching also, we have been teaching this topic since long. But what I feel, my understanding as a teacher is increasing day by day, for this topic at least. The way I have gone through this topic when I was doing my undergraduation, least importance was given to this. Only few words, you should know what is Naishthiki Chikitsa, you should know what is Satya Buddhi, because they are going to ask this only in Viva. What does it mean? Because even whosoever comes for Viva, he is not prepared for this. Because we are examiners, we cannot expect that kind of maturity from UG student to have what is, because he may mug up the thing, like a parrot, he may recite those. But when we talk about the understanding of this and to bring it to your practice, it is not easy. And that's why, and those who have got interest, they will start searching the topics related to this. Because the word, when we are talking about Naishthiki Chikitsa, this term is coined here only. Okay, other, say, Yoga Darshan is talking about lot about this Moksha Prapti. Because in our sciences also they have told, Yoga is the route through which you can go. Sharistani says, okay, from here only the path goes. So if you are thinking about this, then at least what you can say, a prerequisite for that is yoga. And this is not the yoga that we are talking about today. Whole world is talking about yoga, but that is only Kaya Nibandhanam. The most important purpose of yoga, or how yoga is going to play a role in Moksha Prapti, nobody has reached. And even society doesn't want to go to that level. They are happy if my body, my weight is maintained, fitness is maintained, they are happy with that. So we are happy with Sharir. So what they are talking about now, for Naishthiki Chikitsa, the summary of the whole presentation is that for whatever references I am going to talk about is that you must understand that your body, your mana, buddhi, ahankar is different from you. It is very easy to talk, but it is very difficult to put it into the practice. Every minute that aham comes, me and my body, we are together. Or if somebody has talked nonsense about me, then I'll feel, okay, this is for me only, that is for my Atma. Because the speaker who is going, or who is speaking ill about, he is also least bothered. For him also, you and your body is one. Your Atma, Mana, Buddhi. So whole presentation, whatever references we are going to talk, is there, they are repeatedly, they are telling the same thing, that this Satya Buddhi should be there, that we are different. And from there your journey starts. This is the baseline. If you understand this, then in Pravrutti, they have given those factors that we should stay away from. In Nivrutti, they have given certain factors that we are supposed to follow. But the fundamentals of what is to be done and what is not to be done, they start it from Sutrasthan only. In previous presentation also we have seen certain things. Because when we are talking about ethics, it is nothing but the ideal pathway. This is what you are supposed to follow and these are the things we are not supposed to follow. So when we are talking about a person who is ethically right, morally right, basically we are talking about a person who is eligible for moksha. That is a baseline criteria. A person who is unethical, he is far, far away. And when I was preparing this presentation, even it has helped me. Because I don't know, like you are all aware about different yonis, na? Correct? Pashu yoni and everything. What do you feel about that? Like whether, because they are also souls, na? So like how the soul migrates in this, what is your understanding about that? Huh? So it means there is a chance of reverse. Can we go into Pashu yoni? Because there are few references where I have read that when you have got a human birth, because again difference of opinion is there. There are few references where it is told that when you are human, it means certainly you have done something good. That because you cannot ask a dog to read a Samhita and be moral. Yes. So what was my understanding that when you have reached up to this level, very rarely there is a chance that you can go backwards. Because first you need to understand what is right and wrong. Correct? So that is what when we talk about buddhi branch, that will tell you when buddhi is branch, it means the person doesn't know what is right and wrong. So first he has to overcome that. Correct? When you know what is right, then there comes dhruti. That okay, let us, though it is difficult, but follow what is right. And again, it is very difficult to keep it always in your mind, what is right, what is wrong, and what is to be followed for a very long time. Then the third concept was introduced, smriti. So first base is dhi, it will tell you what is right and wrong. Then dhruti will guide us to maintain it for a very long time. But as being a human, going through different kind of situations throughout a day, there is a chance that we may forget. And that's why Smriti came. So the baseline for this also, in Sharistan only he tells that from Sharistan first chapter only this concept was again, though it was there from Sutrastan, there also it was repeated that we should stay away from Di Dhruti, Smriti Vibransh. So it means, so what I felt previously was there is no chance to go back. If you have reached to this level, then just you need to correct Di, Dhruti, Smriti, and then the path is towards Moksha. But when I was preparing this presentation, clear-cut guidelines, there is a chance that you can go back to Pashu Yoni. Very clearly he says. But I was under the impression, no, now there is no reverse. Okay, it is like you upgrade yourself. It is like continuing medical education. We update ourselves so that maybe next birth will be, and there is no chance that we will go back. But now, here, and that's why again this is important, that this is a, what I can say, alarm. That be cautious about that. Otherwise, you will be going back to them to whole day we are thinking about that, and we are not treating all those animals or like inhuman kind of attitude. You can be one of them, maybe in the next birth. So now first, before I go into the details, and like Naishthiki Chikitsa, some references in Yoga Darshan we find not with this word, but the same kind of concepts they have talked about. Almost like as I told in the morning session when I had a discussion with Srivas sir, I collected all the books from Yoga Darshan and like let us start from Ayurveda. But by the time I come here, I could only finish the content which is available in our Samhitas. So still all those 10, 12 books are only one book I could read. But still I am not able to accommodate those references because 89 slides are there and I could only, if I am 100% sure I will not be able to finish this presentation. Because this is not that much easy to understand. Even after preparing the presentation, I need to go it 3 or 4 times. That how I need to communicate it. Because reading is something different and convincing is something different. And for that, all those persons who are having those kind of understanding, for them it becomes easy. In receptive mode they will be there. And if my karmas are not in that line, Though if I see this kind of presentation 100 times, then also I'll not be convinced with these kind of things. So preaching is one, following is again difficult, and to follow it for a very long time and to practice what they have mentioned, it is again not that much easy. So being moral, being ethical is very easy. This is the basic line for that. But to go, and that's why it is told now, it takes multiple births to reach up to that level. And most important, many times they have reiterated that you need to, it depends on your karmas, that you will get a guru who will help us. Because when we are talking about professional field, like being a doctor, we are in professional field. With only reading, with only skills, we cannot be a good doctor. We require a very good teacher who will hold our hand and who will teach us, okay, this is how you need to check your patients. This is how we need to treat. This is the boundary where you need to stop. This is where you can go beyond, and continuous updating. Correct? Here also the same is there. To become a doctor is very easy, but to get a guru who will help us for this is very difficult. Because nowadays, whatever gurus are available in society, I have doubt about them, that whether they are certainly working on this. Because there are gurus, I am 100% sure that they will not be in human yoni, they will be going back rather. Because if you see, whatever examples are available around, that for 10-15 years with a long-term following and preaching, and suddenly some scam comes and everybody is shocked. So I have very reserved opinion to make a person guru. Because what we are seeing, that is something different. Because until and unless you spend 24 hours and maybe a year or like that with that person, then only you will be knowing what that person is and whether you should follow him or whether you should not follow him. So again, there are karmas. Unfortunately, I didn't have that good karmas. So I still am searching for a guru who will help me in this. And I'm open about that. There is nothing wrong in that. Okay, lot of reading is going on. But to get a person where you will surrender 100%, no looking back, still I'm struggling with that. I don't know about you. You might be ahead in this journey. Correct? But yes, it totally depends on our karmas to get this kind of, and this is beautiful concept, and that's why I told you, when Sharistan, because the whole syllabus is divided, Sharistan first chapter I was supposed to teach. In syllabus, I told you minimum lectures are there. I took 8 lectures. It is not easy for a UG student to understand. So very slowly you need to feed him. If whole chapter, it will be ajirna. So I tried my best to, and most important, whenever we are teaching, we need to have some examples. Then only, drishtantas should be there, then only they will be able to understand those kinds of concepts. So what are your thoughts about this? What do you feel? Because now with this syllabus and everything, like we rotate, previously we used to rotate the syllabus amongst all the faculties. But after QCI we have stopped. Because if you rotate, again, those non-lecture activities you have to prepare. And the non-lecture activity my colleague might be doing, I'm not okay with that. I need to come up with new activities. So it is not like right also to have all the formats. And even the formats which are there, which are provided by different universities, I'm not okay with that. Like when first year syllabus was designed, Gujarat Ayurveda University, they came up with some journal and everything. At my institute, we do not have journal. We only have formats for different non-lecture activities. Those soft copies will be given to the students and those activities will be conducted. What I feel is, what is the beauty of this syllabus is liberty to the teacher. If you are going back to that old pattern of journals, actually it is in long run, it is not going to help us. Now you are free. You need to have whatever teaching learning methods you need to adopt, whatever formats you need to, you work with that. So for example, 2-3 years I am using certain formats. After that I feel, no, this is not good. Let us change. Even let me give you this first-hand feedback from my 2023 batch students. If you go through Padartha Vidya, there are some activities where we feel that these non-lecture activities are not good for adult learners. They are for primary or secondary kids. We feel embarrassed to conduct those kind of activities with first year and second year BMS students. So like there was one survey which was conducted at my institute. So what do you feel about this non-lecture activity? Because the non-lecture activity should be a triggering factor. It should motivate him to think about that. But sometimes he feels depressed. Sir, what is this? ये तो 10 मिनट में हो जाता है. What is this? So what we did is we removed those non-lecture activities, though they are part of syllabus. Because if my student is not okay with that, if as a faculty I feel that this is not up to the mark and we are doing something nonsense thing in the class for an adult learner, then we should not do it. Come up with new activities. Correct? So when we restrict ourselves, that is not good. Let us be open. And so like when we are taking these kind of topics, it is not easy. Okay, you can finish the syllabus, but I feel at that age, that maturity is not there and that understanding is not there. Because the Sharistan chapter, when I was it took me around 2 months to finish. So very slowly I learnt it and I felt that this concept cannot be taught within a month or 2 months, gradually from first year, then second year and third year. And that too, out of 100 students, only 2, 5, 10 students will be interested because it is aligned with their own karmas. If he is aligned to have these kind of practices in future, then only he will have interest. Obviously, teacher has a role to motivate, but these are the topics that are not easy. So my understanding of these topics is gradually increasing and now it motivates. First, like when I learned it in first year, these topics were considered as boring kind of topics. What is that? And even teachers were not interested to teach these topics. Only few shlokas are there and finish. Correct? So until and unless my understanding increases, I cannot help my students. So last shlok, I'll not share that. You all know that shlok. But I feel that that shlok has been beautifully written. That has nothing to do with Ayurveda. That how your learning takes place. Certain years are required to learn certain things. You cannot teach these topics to a 15 or 17 years kid. Correct? So now before we start this presentation, what you think about Naishthiki Chikitsa and how one should practice it? Because till this topic was given to me, even I didn't read this so much seriously. I was knowing that like Naishthiki Chikitsa only Purush Vichaya Shariram. That's it. But when it came to a presentation, I thought, yes, everything is connected. Everything is connected. So what are your views?
We usually don't practice it.
We usually
Don't practice.
Don't
Practice it.
practice it, correct? Absolutely. Are there any reasons for that?
Lack of awareness.
Yes, lack of awareness. Fine, absolutely correct, agreed.
Influence of
We
colleague.
are driven by needs.
Yes, we do not have that much time to think about this. From morning to evenings, we are so much occupied that we do not. So everybody thinks about this after retirement only. And by that time, whatever we are not supposed to do, which is written in Pravritti, we have already done that. And whatever they have told that it is to be done, now we are reached to that level of physical weakness that we cannot practice. So it is not a topic which is to be followed after retirement. But most important is what I told na yadyad acharati sreshtaha. You need to have role models in front of you. That, okay, this is a role model and he is going towards moksha. How many examples we are having in the society that you can look up to? Very, very few. And again that time telling karmas, that is aligned with our karmas, that we are not getting that. Because in Bhagavad Gita also and other reference it is told that if your karmas are good, then you will find a good teacher at a good time. At a right time you need to find. If I find a teacher at the age of 65 and 70, my karmas are like that, I have to come back. There is no chance that there is moksha. Correct? So at an early age, if we are trained in these kind of things, then only, and that too repeated. And that's why when we are talking about Achar Rasayan, when we are talking about Sadvritta, because Achar Rasayan is why it is told that we should be with these kind of people, Sattvic people. Because if for a very long time, if in our family, in our society, or in my surrounding, these people are there, then indirect impact will be there. I'll imbibe those qualities. Correct? If these examples are not there, then how I am supposed to read this? Nobody is following in the society. Everybody is doing which is in the category of not to be done. How I am encouraged. And also, now moksha is considered as something very elite class, correct? But nowadays, as he was talking about, again, Kali Yuga. Today the success is measured from your bank account, which brand you are wearing, whether iPhone is not there or not, whether watch is there or not, which car you are driving, correct? In which area you are staying in the city, where it is elite class or not. So all these things, they immediately motivate a student, correct? They will follow if they feel that financially you are very stable, correct? And then only they are going to follow. But only moral preaching is not going to motivate them. They need to see that, okay, you have followed these principles and you have become successful. Then only they are going to follow us. So whatever we are going to talk about is again very rarely we find in society, isn't it? Any other thoughts about this?
No structured SOP.
Correct. Because person to person the SOP changes. Now this is a very okay, these are the parameters that we are supposed to follow. But each of us are coming from different cultures. We are born and brought up in different conditions. And to mold everybody in the same pattern, that is not easy. And most important, there is no formal moral education. What I feel is what our syllabus lacks is moral education. Previously, when we were a part of Gurukul Parampara, it was when we were talking about the accountability. It was the accountability and responsibility of the teacher that his student should be successful. Now we are least bothered if I am giving 100% result and if he goes outside, whatever he does, it is his own karmas, I am least bothered about. But previously it was not there. You are responsible for the not only financial development, moral development as well as his journey towards moksha. This was the moral responsibility of the teacher, and that's why this education was there for 20-25 years. Now you are student. Again, I'll give the reference of Gurudev Singh sir. Whatever, the students are coming from different backgrounds, correct? It's a PG Institute, Jamnagar. So what he used to say is, he used to tell in Hindi, कि यहाँ पर जितने भी घड़े आते हैं ना, सब पक्के घड़े आते हैं, है ना? और पक्के घड़े आने के बाद उसको आप मोल्ड, वो सिर्फ टूट सकता है. You can break it, but you cannot give another shape. So all the students who are coming at Jamnagar, if he is coming from Mysore or Kerala or Maharashtra, all their thoughts, whatever, as a UG teacher, whatever we have fed them, now that slate is not empty now. Correct? There's no place to write something new. So he told that whatever we are doing is only supporting them. But you cannot expect a student to change everything. Whatever his thoughts, he is going to, whatever he feels, okay, if he feels, if he has seen many patients who have got very good results, then he might be following. But if he is coming from such a college where, because when I did give these entrance examinations, that time there was no centralized, correct? So we used to go to BHU, then NIA, so we had a talk with students. That time people used to laugh at us that, okay, you have seen woman? So that time to see a woman or to see a Virechan was a very rare phenomenon. Nowadays still awareness and Ministry of AYUSH and everything, every college is doing something. But that time only preaching was there, but on ground the students were not, they have not seen a single patient treated with Panchakarma. Then how do you expect that Jamnagar will train him and he will be a very good practitioner? That is next to impossible. So the same is here also. So whatever cultures, and because this education starts from family. There is no formal education. Nobody is teaching how, there is no classes like online, offline material is available that who is going to guide you that how moksha. Because whosoever achieves, he doesn't come back to tell you. Because for example, if I am selected at Jamnagar, I can conduct a classes that how you are supposed to reach to Jamnagar. But a person who has attained moksha, he is not going to come back. So actually, a person who has got a first-hand experience is not here to tell us. So ultimately we need to read, and accordingly we need to find, okay, this is good, and okay, aptopadesh. We only need to, there is no pratyaksha, there is no anuman, there is only aptopadesh. So whatever they have written, we need to have 100% faith in that. And if you follow, irrespective of from where we are coming, then only gradually we are moving. I cannot expect that in one birth we can, from this level you can reach to this and directly there will be moksha. Again, few more births will be required so that we can reach up to that level to attain moksha. And nobody is bothered about that now. When in first year, when a student gets admission, if you see there what we call it as those 15 days transitional curriculum, there is one goal setting. Nobody has a goal to achieve moksha, even not a teacher. Then how do you expect that we will help them to go? So yes, this is only for adult learners to talk about. We can have a discussion or debate about that, but person who believes in these fundamentals is only going to follow. Correct? So now again, as I told you in the morning, yes, these are the topics. Again, all these topics are interrelated. We cannot, we'll talk about Upada and we will not talk about Moksha. That is not going to happen. So all these topics, somewhere they connect, and ultimately all these roads merge together and go to a final path of Moksha. Now, yes, as I told you, when I started, say for example, when we prepare for exam, our goal is 70%. But by the time exam comes, it gradually, the same has happened with me also. I started with multiple books, but I could finish only Charak Samhita and Chakrapani commentary. Chakrapani has also beautifully. Even when I was reading, there are very good references in Charkopaskar. Very good references, because Gangadhar has got a very good philosophical understanding. But I didn't have the time to go through all those references. But now I have the references of this. Future, if I get the opportunity to have the same topic, certainly I'll be coming with all those references for other, because I have shortlisted the references. Yes, from where it starts? It starts from here only, as per the commentator. We all are familiar with these references. Saha Ananta Param. Correct? In this shlok, there is no relevance of moksha. Correct? This is about Ayurveda. Correct? Now, while commenting on this, beautifully he says, Ananta and Par. Here we are talking about Ayurveda, which is, we don't know the beginning and we also don't know the end. So this is a general meaning that we are taking. So here he says, Avidyamanav Antaparav. Yasya aso anantaparaha. This is a simple understanding which is made. But further he says, Param utkrishta phalam. Yasya ayurvedasya asau anantaparaha. So here he says not only that, only treatment is not the ultimate aim of Ayurveda. Because when Charak touches all these concepts, he also expects that out of 100 physicians or 1000 physicians, at least 2 to 5 should work in this line. And whatever they have told in Sadvritta, if we start following, we are already on the path of moksha. So, Chikitsa to Naishtiki, this is the first reference he gives. Chikitsa to Naishtiki ya vina upadam. Here is a cross reference they are given. Atra Naishtiki moksha sadhana hetu. So in Sutrasthana first only, if you read it properly, there only he has when you talk about adhikaran, swastha se swastha rakshanam, aturasya vyadhi parimoksha. But in the latter slides, in the last 2-3 slides, you might be knowing about, there are 2 kinds of vidya, paravidya and aparavidya. Correct? So the whole, whatever from first year to final year to PG to PhD, everything what we are doing is aparavidya, materialistic word. When we talk about paravidya, it is about going beyond the cycle of birth and death. And that's why he says here, Naishtiki moksha sadhana hetu. So ultimate aim of all these references is to reach up to this goal. Now, yes, after Sutrasthan, I couldn't find a reference. Directly, I need to go to Vimanstan, where, and also all these references are in red because actually they are not related to my topic. But why I am sharing these references, that also I'll share. Now, this is from Vimanstan, correct? This is about different kind of pariksha. And then there's a discussion about whom to be given woman, how the patient needs to be examined. Then how we need to shortlist that to whom we need to give Vaman, Virechan. So here the words you can see, katham cha parikshitavya. Then kim prayojana cha pariksha. After doing pariksha, kvacha vamanadinam pravrutti. So here actually this pravrutti word has nothing to do with the pravrutti which we are going to talk about from Sharistan. Same kvacha nivrutti. Correct? So whether I should give Vaman, that is pravrutti. Whether I shall refrain myself that the patient is not eligible, I should not do Vaman, that is nivrutti. And most important, what he says, what about those patients where you will find the lakshanas of pravrutti as well as nivrutti? It means after the examination of patient, there are few criteria which says me that I should do Vaman. But again, there are few criteria which guides me you should not do. So I am a confusing condition. Few criteria, he fits in the criteria that woman should be given. Then again there are few criteria woman should not be given. Then what is to be done? Then he says pravrutti nivrutti lakshana sanyoge cha kim naishthikam. And for naishthikam, so here this pravrutti, nivrutti and naishthik, same three words which are there in Sharistan, which talk about pravrutti, nivrutti and naishtiki, which is about moksha. So naishthikam iti, Chakramani says nishtha nishchaya tad. So here naishtiki or nishtha means confirmation. You need to reach up to the conclusion whether I should do it or I should not do it. Kim nishchayena kartavyam iti artha. So there should be some reasoning. Na? Okay, there are some criteria which are telling me that woman should not be done. But then also yasam karyam akaryam sat, with that principle I can go with woman. So here pravrutti, nivrutti, naishthikam, these words are there, but they have nothing to do with Naishthiki Chikitsa. And here Naishthiki, this word is only restricted to confirmation. That you need to come up to the conclusion. You cannot be in a state of confusion. Moha should not be there. So that's why I have marked them red. Though the same words pravrutti, nivrutti and Naishthiki, but they are nothing to do with the main concept. This is again pravrutti nivrutti lakshana sanyoge tu guru lagavam sampradav. We need to wait. We need to weigh the pros and cons, and then only we need to decide nishtayam, that whether we should go, and that's why it is told sampradarya samyak adhyavaset adhyavasaya buddhi. So ultimately you need to have that knowledge, you need to have that skill which will help you in that condition to take the right decision, which will be helpful to your patient. So the concept of moksha, words are same, but they have applied it in patient, that this situation you will be facing regularly. Further again, pravrutti nivrutti lakshan sanyoge kim naishthikam adhyavaset adhyavasayam kuryat. Then he said anyatara nishtayam iti. You can go even say if you are decided woman has to be done, even there are chances that other physicians may go beyond that. Anyatara nishtayam. So tena shastra karena guru vyadi pratikara nishtayam adhyavasayam kuryat. So depending upon say if it is going towards 70-30, then guru you follow, okay, 70%. If you are sure that okay I should go with this panchakarma, you should go ahead with that. So accordingly they have guided. Now coming back to the main topic, where directly Sharistan, and many times when we introduce students Charak Samhita, we translate Sharistan and it is only about anatomy and physiology. But unfortunately, that's a very wrong statement. And specifically talking about the Sharistan of Charak Samhita, it has nothing to do. Main focus of Sharistan is moksha. A whole chapter they have written for Prayojan, Loka Purusha Samya Siddhanta. So, Atyanta Dukkha Uparama, Moksha Karana Chikitsa Upayukta Purusha Vedadi Pratipadataya. This is the adhikar, that is what they have written this chapter. Now, these are the questions as usual. Kochaita Vedanaha Sarvam Nivrittim Yanti Asheshata. So a question has been raised by the student that what are those ways so that permanent relief from the miseries is possible, and most important, if the person reaches to that level, what are the criteria? Unfortunately, as I told you, when the person goes to this level, there are no lakshanas. Correct? So that's why Ekha Prashantu Bhutatma Kai Lingair Upalabhyate. So Vedananam Karanam Adhishtanam cha. So in the beginning only, Sutrasthan, they have given these details, but the major content they are going to discuss, that is in Sharistan. Now only what is written here discuss. So when Katida Purusha, when he is talking about that, this is Rajas Tamabhyam Yuktasya Sanyogo Ayam Anantvan. In simple line, if Raja and Tama is dominant, then you need to come back again and again. Until and unless we get divide of this Raja and Tama, Sattva Vridya Nivartate. Then only this is possible, and that's why all those Sadvritta, then Manasik Prakruti, then Achar Rasayan, then Dharaniya Veg, all those concepts are indicating that please try to follow these kind of guidelines. So gradually Raja and Tama will read. Yes, so but ultimately Sattva Vridya Nivartate. So gradually these practices, so birth by birth, what we feel is when the Atma migrates from one body, it is migrating all with mana, and most important are karmas. And that's why in Sharistan he repeatedly tells. And even I am very fascinated about the word avahita in Charak Samhita. So what I always tell to my students that whenever avahita, that is a red flag. You should be extra cautious. Whenever he uses avahita word, it means your focus should be there. This is a warning that, okay, here, okay, all principles are there. Aptopadesh, you are going to listen everything. You might not be following, but whenever he says avahita, it means this is expected that 100% you are supposed to follow. So now in Chakrapani, what he says is, okay, Samprati Sansaranam Moksha Hetu. So if you want to go beyond this sansar, for Moksha Hetu only, so Sattva Vridya Karana Bhutaya Rajastamo Nivritya, all slides, whatever we are going to talk about, the conclusion is same. Rajatama should be reduced, Sattva should be increased, and me and my body are different. This is the moral of this principle. Then Sanyogo, Purusha Rupa Sanyogo Nivartate, Moksha Bhavati, same wordings will be different. Sattvam Vruddham Vishuddha Jnana Jananat, and there comes the concept of Sattva Shuddhi. So whole concept of Pravrutti and Nivrutti, why they have written Nivrutti? Because Nivrutti is nothing but Sattva Shuddhi Upai. And if Sattva Shuddhi Upai is there, then only Satya Buddhi will be there, and then your path goes to the next one. So Sattvam Ruddham Vishuddha Jananat Rajastamasi Sansara Karane Vijitya. It only gives you the power to go beyond this cycle of birth and death. Naishthiki Chikitsa, this is a reference specifically from commentary. Here we know this is about the person, what we are doing it. So Atra Karma Phalam, Chatra Jnanam, Chatra Pratishtitam. So when we are talking about this Rashi Purush, everything is here only. So that's why Atra Moham, Sukham, Dukkham, Jivitam, Maranam, Swata. Evam yo Veda, a person who has understood this, Sa Veda Pralay Udayo, then he has understood Pralay and Uday. Here we are not talking about the Pralay and Uday of Prakruti. Here we are talking about a person who is taking repeated birth and a person who is going to be liberated. So that is Pralay and Uday. Paramparyam Chikitsa. So Paramparyam also they have very beautiful commentary here. So Chikitsa Chaiti Naishthiki. Now, when we are talking, Chikitsa word is only coined about patient, right? When we are talking about all those Yukti Vyapashray and other, even Sattva Ujaya Chikitsa is for patients, really. But here, when we talk about Naishthiki Chikitsa, it is beyond all those kind of Chikitsa. So actually, we are not treating the individual, but here more role, because when we are talking about other kind of Chikitsa, there is a role of a physician, there is a role of a patient. But when we are talking about Naishthiki Chikitsa, when somebody has educated you about this, then 100% responsibility lies with me, that how much I have understood and how much I am going to follow. So Chikitsa Chaiti Naishthiki Atyantika Dukkha Chikitsa. So repeatedly this word they have used, Atyantika Dukkha Chikitsa, Moksha Sadhane Gyatava. Now again, these are the few references. When he talks about that Purusha Karanam Kasma, why we are here. So all these things are there. Bhastama, Satyam, Anrutam, Veda, Karma, Shubham. Purusho na bhavetedi. Purush is not there, then there is nothing like that kind of importance. Or all these things will not be there if Purush is not there. So na Vijnanam, na Shastrani, na Janmam, Maranam, na Bandho, na Moksha. So here we are talking about a Purush, Rashi Purush, which is associated with Atma plus also Shardatmatmak Purush as well as Chaturvinshati Tantvatmak Purush. Syat Purusho na bhavetidi Karanam Purusham Tasma. So after while answering one by one, he is going to decode these things. Then Prabhava Purushasya Kaha. For what purpose? What is the Prabhava? Then Paramatmana Purusho Rashi Samgyastu. Here he says Moha Ichha Dvesha Karmaja. Because when we say that the some person is like trapped in this cycle due to this reason, that is Moha, Ichha and Dvesh. So this is about Rashi Purush. Moha, now a very beautiful sequence he has given. Mohathi bhaveshu ichha dveshasya bhavati. Moha leads to ichha dvesh. Then there will be pravrutti, because Raja will be there, he will be continuously active. Some motivation should be there for activity. So motivation can be positive, can be negative. So that's why moha and ichha and dvesha. Either I'll be doing because I want to achieve this kind of things, and I don't want to do this kind of things because there is a dvesha. So that is a basic motivation for pravrutti. Then that pravrutti leads to dharma and adharma. Whatever activities we are doing, either we will be doing good or bad. Tauch shariram janayato bhogartham, and those karmas are going to bring us back in this cycle of birth and death. Now this is a cycle that they have told, that moha, correct, leads to ichha and dvesh, and that ichha and dvesh leads to pravrutti, dharma, adharma. As soon as we are trapped, if you are dharma, then something good will be there. But for sukha and dukkha, we need to come back. So that's why dharma and adharma leads to sharir bhogartham. So in this cycle, we are continuously trapped. Now this is about jnana pravartati and na vartate. For that he is telling, atma gyaha karanair yoga jnanam tu asya pravartate. So that knowledge is only possible when atma is associated with karanas. And karananam avaimalyat ayogatva na vartate. Now this is important. Avaimalyat means if they are raja and tama dominant. But ayogat, that can be optional. When we are talking about whole nivritti upayas, that is ayogat. And that's why there won't be knowledge, because it is told that whatever knowledge is there, there won't be any kind of knowledge after you cross this cycle of birth and death. Because when you go out of this cycle, your existence is not there. Second year student, when we were discussing this chapter, he asked me a question, sir, what happens to Atma? Okay, this is very good. Okay, we will follow, but what is the outcome of that? What should I answer? He told me, what is the meaning of moksha? A second year student. I didn't expect this question. What should be my answer? What happens to Atma after moksha?
It doesn't get associated with Pachma.
Okay, so it will remain there.
Atma's always there everywhere. Just the association is broken with the sharir.
Then what is the fun of having independent Atma? What is the fun of moksha if it is going to remain there? Because if he remain there, whether he will be a third person, okay, very good, he is not doing moksha practices, you suffer. What happens to Atma?
Remain as in, it is, you can say it's converted into Paramatma from Jivatma, but that is just colloquially.
Okay.
But Jivatma into Paramatma Leela.
Correct. That is what my understanding also. So because this is the highest kind of ethical level. Because when you follow this, actually you reach up to the highest ethical practices of Paramatma. So now there is no difference. Ultimately that Atma, and this is told in Charak Samhita Shadistan, first chapter in the last few shlokas, that Ekrupa, that it will become a part of Paramatma. Now there is no separate existence. So when we tell actually that Atma will be there, no, there won't be any Atma. There is no separate existence, and that's why they have told there won't be any lingas, there won't be any knowledge. Because if he is having knowledge, then what is the fun of that knowledge? He has already crossed that level. Correct? So when we are talking about, so Karananam avaimalyat ayogatva. Avaimalyat, so it means it is dominated by Raja and Tama. So he will be coming back again and again till he reaches to that level that ayogatva will be a choice. Now I don't want to be a part of this cycle. So gradually, okay, he will be doing the karmas, as in Bhagavad Gita, that what he says that, okay, you have to do the karmas, you cannot remain idle. But you need to dissociate yourself from the fruits, karma phalas, correct? So the same theory. So Karananam avaimalyat makes sure that you will be a part of this world, you will be a part of this misery of sukha and dukkha. Whereas ayogat makes sure that after whole this learning, now you should dissociate yourself. Your karma should be like that. So Karananam avaimalyat ayogatva na vartate. So here this shlok is about actually jnana parampara, correct? So if Atma is associated with mana and other indriyas, the knowledge will be pursued. But when we are talking about those nivrutti upayas, manasi sthire, atmasthe manasi sthire, now we need to take it away from indriyas. It has to control itself, and now we need to only fit it into Atma or spiritual practices. This is how Karananam Ayogatva, and again that is the basic prerequisite which is required for Samadhi, and gradually he will move towards the next journey of Moksha. Now, good examples are there, we already know the meanings, yes. So Atma, when we are talking about, when it is associated with Karan and this Karanas, all tools, then Jnana will be there. Karananam Ayvaimalyat or Karananam Ayogyat, Agnan will be there. But this Karana Ayog, you need to go through this phase. First, we need to have the association, we need to have the knowledge, and after that, this second option will be by choice. Now, when he has reached up to that level, that nothing is left, everything, and this is what even other darshanas are. When there is nothing left in this world to be known, it is the right time for you to move away from this world. This is what Nishriya Siddhi. Then, same kartu sanyogajam karma vedana buddhi revacha na ekaha pravartate. So, and not only that, kartu bhutatma na ashnute phalam. So, alone Atma cannot perform any karmas, and whatever fruits are there, it alone cannot experience those. So, always the whole 24 tattva or this Shad tattva, they are all will be together when you want to experience. So, the next, yes. Anadi Purusho Nityo Vipretastu Hetuja. So, here there is a comparison between Paramatma and Atma. So, Anadi Purusho Nityo, here we are talking about the ultimate soul. Where Vipretastu Hetuja, we are talking about ourselves. Moha Ichcha Dvesha Karmaja, that is Hetuja. Sad Akaranavata Nityam. The first one is Akarana. Nityam, it is going to stay there. We are not going to stay there. When you reach to that level, you will be a part of that Paramatma, and there won't be any separate existence of ourselves. So, Drushtam Hetujam Manyatha. But second, whatever we are here, we fall in this category. So, when we learn all these things, this is a 50-50. Okay, we have reached to this level, it means we have done something good. But we have not done something good enough to go beyond this cycle. So, there's a lot to be learned and to be practiced. Same, yes, here you can see Purusha. When we got Akaran, we are talking about Paramatma, where we are talking about Hetus, because these are the Hetus which will make sure that we are coming back again and again. Because Moha, Ichcha, Dvesha will make sure that you indulge into either good practices or bad practices. There will be Dharma and Adharma, and again we will be coming back here. So Anitya, Jivatma will be there. Yeah, this is also very good. Now, like this shlok, Avyaktat Vyaktatam Yati Vyaktat Avyaktatam Puna. We all teach this shlok in the context of okay, and Srishti Utpatti. But this shlok is not at all related to Srishti Utpatti actually, because here it is talking about Purusha. Here we are not talking about Prakruti. So Purushaha Pralayecha Ishtaihi Punair Bhavir Viyujjate. At the time of Pralay, means when Atma dissociates from other things, Punarbhavir Viyujjate. Again he will be associated with this mana, with this karma, and he will come back. So this continuous procedure of Avyaktat Vyaktatam Vyaktat Avyaktatam, this will be continuous. Yesham, why this is happening? Rajastamobhyam avishtaha. Because our karmas are governed or rather bound by Raja and Tama, that's why Chakravat Parivartate. Continuously we are coming. So many times I have seen faculties that are telling that this is about Prakriti, but this is not about Srishti Utpatti. This is about us only. Yesham Dvandve Parasakti. Those who have got affliction towards this Raja and Tama. Ahankara Paraschayaha. Then Uday Pralayo Tesham. So if we are associated with Raja, Tama and Ahankar, this is for us Udaya. Repeatedly we have to come back. Pralayo tesham na tesham yetu atu anyatha. Those, so if we apply here Tantra Yukti, which says us opposite needs to be understood, then those who are free from Ahankar, Those who are free from Raja and Tama, ye tu anyatha. There is no need to come back. Now here also the details they have given again. Atindriyeyi ati sukshma rupair atma kadachit na viyukta rupa. Always atma is associated with these things. So na karmana, na eva manomatibhyam, na cha api ahankar vikara doshahi, rajas tamubhyam. Always all these things will make sure that we should come back. So jnanam vina tatrahi sarva dosha. The time we first sattva-shuddhi is required, which is followed by satya-buddhi is required. So jnanam vina, till that knowledge is pursued, sarva doshaha tatra, always there are doshas. Gati pravrittestu nimiktam. So gati pravritti, whatever gati that is coming back again and again, and pravritti, whatever activities we are doing, nimittam uktam manaha. Mana is responsible, and sadosham balavaccha karma. So doshas, that is Raja and Tama, and balavaccha karma, whatever strong karmas, either positive, either negative we are doing, we need to come back. So yes, this is there. Here we can see Purusha, Rajatama, due to that Ahankar is associated. So Utpatti will be there again and again. And what happens in Utpatti? Atma gets associated with all those factors. Buddhi, Sharira, etc. So for us, this is Avyaktat Vyaktatam Yati. Now the person has come back. So Vyakta, birth will be there. Then at the time of Pralay, what happens? Atma and Buddhi, they gets dissociated. But as your Mana, your Karma and Sattva Raja has already defined your next birth, that where you have to go. We already know the destination. So accordingly, again there will be next birth. So this Atma and Buddhi will be again associated, and there will be next birth. But in the stage of Avyakta, in further next slok, he is going to tell, there is a chance that you can break this chain, and how it has to be broken, he is going to tell us. So now this is beautiful slok. You all know, Mahapralayehi Mahabhutani Tanmatreshu. While explaining it for Purusha, he is giving the example of Srishti Utpatti. So from Mahabhutani, it goes back to Tanmatra. Tanmatra to, it goes back to Indriya and Ahankar. Ahankar goes back to Buddhi. Buddhi goes back to Prakriti. But that is for Srishti Utpatti. For us, what he is telling? Ayam cha layakramu mokshe api bhavati. For moksha also, same thing happens. But because for Prakriti, avyaktat, vyaktatam, vyaktat, avyaktatam, this is continuous. And when we are talking about this cycle, and when we are talking about moksha, we are not supposed to come back. And that's why he says, Param tu tatra tam purusham prati punha sarga na arabate prakriti. The way avyaktat vyaktatam happens in Srishti Utpatti, that won't be applicable for the concept of moksha. And that's why na arabate prakriti. This is the only difference. Otherwise, both examples are aligning with each other. And again further he says, Ato anyatha iti ye raga dvesha vimukta. Opposite viparetantra yukti. Nirankarasya. Tesham na udaya pralayo bhavati. So again, in every step by step, he is telling this is the only way we can be free from this cycle. Same, this is whole sequence. The same whole sequence is also applicable for Purusha Utpatti also. But we are supposed to break it. Then, yes, this is again very good slok. This is Yatha Svena Atmana that we were talking about, whether the Atma goes back to other yonis. Clear cut, he says, Yatha Svena Atmana Atmanam Sarvaha Sarvashu Yonishu Pranais Tantrayate. Your Atma is going to decide whether I should go towards moksha or my car should go into reverse gear and I should go back to Pashu Yoni. Prano, Prani, Nahi Anyo Asti Tantraka. Many times it is told that Ishwar is responsible. Here it is told, no, both the options they are told. If Ishwar is there and if Ishwar is not there. Both examples beautifully he has given. Now here it says, Samprati Swatantratve api Anishta Yoni Gamanam Akshiptam. How? Samadadati Yathasvena Sarvasu. Then all these examples they have given. Correct? Go, Hasti, Kitadi, Yonishu, Prana is Tantrayate, Prana Yojeti. Who is responsible? Atmana eva. I am Dharma Adharma Sahayatvena. Your karmas are going to define Atmanam Sarva Yonishu Nayati. So our karmas are going to take us either in Pashu Yoni or human. We will continue it. Na para prerito yati. So there is no other third factor who is going to make sure that in which birth you will be going. Now here again further he says, Yato na anya purusho asya preroko asti. No third person is there. Ishvara abhavat. If you do not believe in Ishwar, there is no worry about that. But kyumva sati api Ishware tasya api karma paradhinatvat. Because though Ishwar is there, if your karmas are bad, he is not going to help you. You need to come back. Idam eva cha asya anishta yoni gamane swatantriyam. We are free. So our karmas are going to define that in which yoni we are going to. So anishta yoni gamanam, then all these things fine. So this was the main concept that I wanted to share. So here also, author is very clear that both possibilities are there. This is again very good shlok from Sharistan. Vashi tat kurute karma yat krutva phalam ashnute. Whatever karma we are going to do, yes, we are there to enjoy the fruits. But vashi chetha samadatte. If it is restricted, chetha samadatte, vashi sarvam nirasyati. So it is a dvandva. First line is about a purush who is trapped in this cycle. Whereas second line is about a purush who has gone beyond. So commentary, he says, vashi chetha samadatte. That is, anishte arthe, vashi san ayam mano nivartati. First we need to control it from all the senses. Yadihi ayam vashi na syat, na mano nivartum. So something is there which is controlling the mind. Then aparam api vashitva gamagam. One more thing he said. Vashi san ayam mokshartha pravutta sarva arambam shubha ashubha phalam tyajati. And then vashi tu swayam api pravartamana ichha vashat pravartate. So ultimately that soul is going to decide what kind of karmas he or she is supposed to indulge. Now what is important is there are many, so sometimes I feel that like when we fortunately or unfortunately got admission in BMS, actually we are blessed that this kind of knowledge is with us. And Samhita people are more blessed because only we are going to teach this. Nobody is going to read this and nobody is going to teach. Even best of the practitioners they have not read what is written. Very beautifully, everything is decoded. So yes, we are supposed to read along with the commentaries, and this needs to be shared in a very concise form. We cannot share all the shlokas and their commentary with the student. In very simple words, we need to teach them. Now what is about manasascha samadhana? So it says, manasascha samadhanat paschati atma tiraskritam. Now tiraskritam is a word generally which is used for hatred, but it is for something which is beyond normal. That only can be pursued by a person if manasascha samadhanat paschati atma nitya anubandham manasa deha karma anupatina sarva yoni gatam vidyat eka yono apisita. Mean yoga yoni, in one yoni only he can have the exposure of all different yonis if you restrict your mind, if you control them from other senses. Now here they have given vibhutvam vitpadaya kudyati rohita jnanam. So something which is beyond, which cannot be pursued by our senses, can also be known if you try to control your mind. Then yoginaha samadhi balat tirohitam api pashyanti darshanti. This is nothing but ashta aishwarya we are talking about, that all those 8 powers a yogi is going to achieve. Here the same is told, so that's a yogina, that is only can be practiced by yogis. They only can achieve these kind of things. Please tell me, ma'am, if like time, your lunch time is there. We can continue this presentation post lunch also. And by the time you feel you are saturated, you can tell me, sir, please stop here. Because I feel that this is not that much. And post lunch, again, it will be very difficult for me with continuing with Atma and Moksha. So here, what he is telling, this is about Vedana. There's one question that how we can make sure that the Vedanas from past, present and future can be permanently relieved. So Trikalam Vedanam Bishak only possible due to Naishthiki Chikitsa and that too Vina Upadam. So this is how they have introduced the concept. Sakala Dukkha Harinim Chikitsa Moksha. Only Moksha can provide you that level where past, present, future, all kind of miseries can be gone. Nishtha further he says, and like the word has been broken into Nishtha and Naishtiki. Nishtha Atyanta Dukkha Moksho Moksha Rupaha. So it means Nishtha is actually a synonym for Moksha, and Tadartham Bhuta Naishtiki. For that, whatever measures are told, that needs to be considered as a Chikitsa, and that's why it becomes Naishtiki Chikitsa. This is how they have decoded it. Vina upadam, how it is possible? Then Trushnam Vina. Why? Trushna Shunya Pravrittihi. Because if there is no desire, then there is no activity. And that is the ultimate aim for Moksha Bhavati iti Artha. This is about, you are all aware about this Upada. Parohetu, Dukkha. Many times Upada, Trushna, these words have been used, but ultimate is only desires. So here also Tyaga Sarva Upadanam Sarva Dukkha Vipaga. A very beautiful example has been given here. But what he says, Anarambhat Asanyoga Tam Dukkham Na Upatishtate. This is what the whole chapter has been written in Bhagavad Gita also. Because the question has been asked that how I am supposed to remain idle for a very long time. Because if you have taken a birth, then you are supposed to do either positive or negative. Then he says, okay, you do the karmas, but dissociate yourself. And that's why he says, you don't have adhikar in karma phal. You have adhikar only in doing the karmas. Then only we can dissociate ourselves. So, anarambhat asanyogatam dukkham na upatishtate. And as we are born in India, we are aware with this Indian philosophies, texts. So for us, it becomes very easy to understand this concept. But those who are in other countries, those who do not have these kind of text or exposure, even mythological stories, Ramayana and Mahabharata, because when we talk about the best ethical practices, Maryada Purushottam, that is the best ethical practice. He has taught us how you are supposed to live the life. And also the concept of moksha, somewhere they have it. So for us, it becomes easy to digest. But all those foreigners, when you teach those foreigners, every word they will have question. There's nothing wrong because they are not exposed to this kind of knowledge. Shall we continue? Up to 130. Okay, fine. Now, again, this is a detailed commentary, but I'll only say everything is important. But yes, apravartama, how this sequence happens. So he says, sarva upada tyagatu na ragadvesha. So there won't be ragadvesh. Apravartamanascha na dharma adharma. So if you are not indulged into any kind of activities, then there won't be any dharma or adharma. Then Upat dharma adharma yostu raga desha shunyaha. If you are indulged into those karmas, but if you are free from raga desha, then also karma, there won't be any karmas, positive or negative. That's why upabhogat evakshaya. And this is the important one, sadatura. 2 to 3 places this word has been used. At least 3 references I can remember. One in Sutrastan, 7th chapter, I think, sadatura, when we are talking about Prakruti. Then in Siddhistan, correct? But here also they have used. When in Siddhistan, he is talking about Sadatura, main focus is on Vegas. You are not supposed to suppress those natural urges, otherwise you will become. So at least all those persons who are not suppressing will not be a part of that Sadatura, correct? Then second reference from Sutrastan, Vatala, Pittala, Kafala, Sadatura. But if a person is not having Ekala Prakruti, then he is not Sadatura. But with this definition, everybody who is sitting in this hall is Sadatur. Why? Yes, Sadaturiti Sada Sansara Dukkha Gruhita. If you are happy, there is one reference that happiness is also considered as Dukkha. If you are enjoying the fruits, if you are happy, okay, promotion you have got. 8 pay has been applied, you are happy, that is also Dukkha. Because that will motivate to do more karmas. Say for example, somebody who is due for promotion, pravrutti increases. As soon as he gets pravrutti, he goes into nivrutti mode. Okay, now when after 5 years he will be eligible for professor, then again pravrutti starts. So this pravrutti and nivrutti will make sure that you will be doing certain karmas. And all those karmas will ultimately end up with dukkha. So this is beautiful. This reference I came across with only first time. Maybe previously I have read it many times, but I couldn't understand it, what he meant. So anarambaditi raga dvesha purvaka aramba virahat. So okay, it is as we have taken a birth, we are supposed to do the karmas, but let us be free from these two. Asanyogat aramba shunyatvena dharma dharma. And at last he says sharir abhavecha nir ashrayakam akaranakam dukkham na bhavati. So gradually, though we are doing all these karmas, but we will be free from them. This is how dukkha takes place. So yes, it starts from Trishna. Then raga and dvesh will be associated, which will lead to dharma and adharma, which will lead to sharir utpatti. So the unfortunate thing is that if there is a birth in the house, everybody is happy except the Atma who has taken the birth by this definition. Correct? Parents are most happy, but unfortunately you have brought him. So now again he has to go through the cycle. So dukkha utpatti. So dukkha utpatti starts as soon as you take the birth. Correct? And it continues till the last moment. So it is the opposite. Correct? Viparya tantra yukti. Now upadatyak, no raga dvesh, no adharma, dharma adharma, sharir abhav. So there won't be any birth and ultimately dukkha abhav, and that is the sukha. Correct? Yes, this we have already talked in the morning. Basic, it's karanam vedananam kim. It is nothing but di, dhruti and smruti. So yes, these three definitions, because buddhi is required to, first we should know what is right and wrong. Then we should know what is right, I should follow it. And the third, I should always remember that what is right, it has to be followed for a very long time. So the dhruti, smruti, vibhansha should not be there. That is the basic prerequisite for moksha. Now all these karmas will not go into the details. Whatever they have told in Sadvritta, with Prasanga Tantra Yukti, everything is repeated. In Sharistan, first chapter, Sharistan, fourth chapter, fourth, very little, but fifth, everything is about Sadvritta again. Pravrutti and Nivrutti, so do's and don'ts. So everything they have, but we cannot consider it as a Punarukti dosh. There he says, this is not Punarukti dosh, because Prasanga Vashat, this is important. And that's why all these references we all know. Then yes, Sukha Dukkha Utpatti Kramam. What is the sequence? So Ichcha Deshatmika Trishna Sukha Dukkha Pravartate Trishna Sukha Dukkhanam Karanam. Speaking is very easy, to follow is very tough. Yes, so yes, Sukha Dukkha leads to Trishna. This is a vicious cycle. That Trishna again focuses you, do something, either positive or negative. You do, again there will be this. So this is a vicious cycle, and we are a part and parcel of this till we do some extra effort. And that's why rockets require extraordinary power to go beyond the orbit, isn't it? Gravity, the same is also required. Whatever we are doing, we will be driving the cars around the earth. But if you want that kind of power, which is required to go beyond the gravitational force, some extraordinary karmas, and that too without raga and dosh, without dharma and adharma, then only that power comes. And that's why it is told, where in all, say, rare of the rare person will achieve this. Correct? Because that extraordinary, to reach up to that level, it is not easy for everybody. Then this is about, because when we are talking about moksha, we are talking about atyanta dukkha nivrutti. But atyanta dukkha nivrutti cannot be talked about how this Vedana actually appears. So these are the locations. Then now this is about moksha. That moksha is nothing but setting yourself free, and that too permanently. It is not coming back to the same cage. We are familiar. Now here, moksha atyantika shariradi uchcheda. Permanent. There won't be any combination of atma and sharira. Nisheshe na punarbhavati. There is no. And yes, this is also important. Comparison is done. Because moksha is, yoga is considered as prerequisite. Correct? Because from yoga, you can achieve only nivritta vedana punarbhavati. It will come back. But if the efforts are made for moksha, then there is no coming back. Then yatha yoga, how this yoga is responsible for permanent relief of the misery. So atmendriya mano, yes, this is this line very rarely. I think 2 or 3 places the whole 2 padas have been repeated in Charak Samhita. 2 references I know. You can add if you know more. Atmendriya manoarthanam sannikarshat pravardate vyakta tadatve ya buddhi pratyaksham sa niruchate. First line is exactly same. Second line changes everything. Correct? Rest of the 2 padas, sukha dukkham anarambhat. Most important, the crux of moksha is given here, atmasthe manasi sthire. You need to take that mind away from indriyas. We need to focus is in atma. Nivartate tad uvatvam vashitvam chopajayate. Here vashi doesn't mean atma. Here vashi means that atma who has got extraordinary powers. That ashta ishwarya. Sa sharirasya yogagya yogam. So with sharir only, that atma can know many things which is beyond the control of common man. So that's why here for yoga he says, anarambaditi vishay upadanartham manasa anarambhat. We should not go into प्रवृत्ति आत्मस्थे मनसि इति विषय निवृत्ते केवल आत्मज्ञानस्थे. Unfortunately, everybody reads spiritual book only in retirement. And when nothing is to be done, you have got lot of time, nobody is there to talk in the family, then only we will start reading. But yes, there are few people who are regularly reading this, but again the number is very less. Vashitvam, he says, Vashitvam Vakshamanam Ashtavida Aishwarya. He has coined the term Ashtavida Aishwarya because after this they are going to give the details. So with yoga, when all these things are done, it is a prerequisite. Gradually you are moving towards Moksha Prapti. Now, Ashta Aishwarya, we all know, I will not go into the details translation. This is beautifully described by Chakrapani, correct? Parapura. So when he is talking about Vashitvam, Vashitvam is gaining those kind of powers which is beyond the control of a common man. So all these things, correct? And here also he has given two opinions. For here, for example, if you say Avesha Chetaso Jnanam, two different meanings are there. But in the next, he says Avesha Chetasa iti Parachetasa Pravesha. So Parapura Pravesha, Parachetasa Pravesha, and Jnanam, this is important. If you see here, it is Jnanam, Chetaso Jnanam. That is Parachitta, what is going on in your mind. That this person should stop. Lunch is there. That is Parachitta Jnanam. Correct? So here says Sarva Atita Anagatadi Jnanam. Past, present as well as future. You reach to that easy. Manasik Shuddhi, whatever roots they have given, it takes years and years to practice for Sattva Shuddhi. Nirajastamakas. In this materialistic world, to remain Nirajastamakas, that is not easy. When you become Nirajastama, people will be happy that competition is reduced. Correct? Because there is no competition for moksha. All competitions are for materialistic kind of things. So here there is no competition, open. Whatever you want to do, do it. So manasa atmani samyak adhanas. So only few words so that we can wind up within 20 minutes. Now the concept of satya buddhi, we know that when we are talking about the prerequisite, satya buddhi is something which is required. Without that it is not possible. Now here in this like why it is required. So yavat na utpadyate satya buddhi na etad aham yaya. So now for that again he gives the detail that sarvam karanvat iti sarvam utpadyamanam. So like what is sarvam karanvat? So when he feels that, when he is associated with buddhi, ahankar, sharir, everything, that combination he is talking about. So sarvan karanvat dukkham, that is dukkha. Aswam, that is not created by me. That is anityam. Nacha atma krutakam tadhi tatra cha utpadyate swata. Because swata, it is mine. So that kind of feeling is there. So by the time he receives this kind of feeling, that I am different from all these entities, that is what which is required. So here just a minute. Satya buddhi samyak jnanam yaya satyaya buddhya na etad buddhyadi aham kintu bhinna. So only that feeling is required, that I am something or my entity is different from rest of the parts of Rashi Purush. Na etad buddhyadi mama kintu prakruteh prapancha. So whatever is around me, or this combination, it is nothing but prakruteh prapancha, and sarvam ativartat iti sarva buddhyadi tejati. So we need to reach to that level where like my own entity or soul should be different from all other entities. So that feeling is expected. And then he comes up with the idea of nivrutti. Just a minute. Whether pravrutti I have finished. Fine. Okay. So this is only the reference of nivrutti because in this chapter only he has given the details about what is pravrutti and what is nivrutti. So tasmis charam sannyase samulaha sarva vedanaha sasangya. So this is only introduction of the topics. Details will be covered in Sharistan 5th chapter. So charam sannyasiti paschat bhavi sakala karma sannyasi. In future whatever karmas we are going to do, we need to have sannyas or we need to stop. So that should be nivrutti. Then few references, just a minute. ज्ञानेन साक्षात दृष्ट भाव स्वभावेन यह सर्व संन्यासा क्रियते तत्र समूलाः सर्व वेदना along with its own causes ज्ञानादयाश्च शरीर उपरमाद एव उपरमन्ते. So here we are expecting, we need to stop here. So nivrutti or uparam, that concept they have introduced in Sharistan 1st chapter, and that is only possible with this Tattva-jnanam api hi moksham janayitva nivartate. After getting or after reaching to that moksha, then there is no existence of knowledge also, because there is no need of knowledge. Now that soul has become a part of ultimate soul, so now there is no need or there is no existence of knowledge. And that's why in the morning only I was talking about a person who has got first hand experience of moksha, he cannot be there to guide us. So that's why it is very difficult to have a first hand experience. Now this I'll skip. This is about this one. Ekaha prashanto bhutatma kair lingair upalabhyate. So what kind of science will be there? So he says atah param brahma bhuto bhutatma na upalabhyate. That is not possible. Nisrutaha sarva bhavebhyaha. Now he is free from all kinds of those bondages, and that's why chinnam yasya na vidyate. That's why we cannot have a science, that what kind of science will be there of a person. Then here Brahma Bhuta, now it has become a part of ultimate soul. So that's why Brahma Bhuta iti prakrutyadi rahita. All those parts of Rashi Parush, they will not be there. Then Chinnam nasti va iti darshayati naksharati anyathatvam na gachati. So that's why when we are talking about in the last few slides, they have given the synonyms. There this akshar word they have used, because after that there is no deterioration. That is our final destination. This is only one reference where some they have given like this one only. Sarva bhavan parikshat api vina api indriyahi samadhi balat eva sarva yasma sarvagyo bhavati. So when person tries to do these kind of practices, and this is the first stage which is expected to be followed by yogis also. Like ched adhyatmam atma jnana balam mahat indriyani cha samshipya manah samshipya chanchalam pravishya adhyatmam atmagya. So ultimately like our mind needs to be engaged with only spiritual kind of practices. This is expected here. Then Sanshipya, he further says, commentator, Vishayabhyo Vyavarta, we need to divert it. So where we are supposed to engage it, Mana Sanshipya iti mano api atma vyatirikta vishayat nigruhya. So anything which is not in line with spirituality, we should not be engaging ourselves into those kind of practices. Chanchalamiti swabhavaha. Then if somebody is trying to follow these kind of practices, sarva bhavan parikshati vina api indriyahi. Because now all indriyas are dissociated from the vishayas. So actually in first hand he cannot have the exposure what is going on around him. So he says vina api indriyahi samadhi balateva. So now the mind has reached to that level that it doesn't require indriyas to get that kind of knowledge. So samadhi balateva yasmat sarvagyo bhavati tasmat gya swabhavaha eva nirindriyo api atma. Though indriyas are not like used for the perception of shabda, sparsha, rupa, rasa, gandha, but then also with samadhi he can reach to that level. This is only introduction in Mahati Garbha Kranti, that only one sentence they have given, eva mayam loka samhita purusha buddhastu eva drashtu michanti. In commentary, not here, the next one somewhere, just a minute. Buddha samyak jnanavantaha. So those where satya buddhi is there, who are free from moha, ichha, dvesh, for them this word buddha samyak jnanavanta moksha yukta ityava. They are only eligible for reaching up to that level. So now many times, like when we talk about this loka purush samya siddhanta, only our students will be telling that what is there in outside, the concept of microcosm and macrocosm. So like, but ultimate purpose is clearly they have written. This is not for that kind of analogy. The ultimate aim is to reach up to moksha. So loka purusha samya kathanam cha mokshartham eva purush vichaye swayameva. So details will be discussed in purush vichaye. So here they have given this concept, and here it says taccha na prapanchitam bahuvachyatvat atah prapancha abhidhanartham. This whole chapter has been written. Then this is about prayojan, why this chapter has been written. So sarva lokam atmani atmanam cha sarva loke samam anupashyata satya buddhi utpadyate. For satya buddhi this kind of feeling should be there, oneness, feeling of oneness should be there, then only this is possible. Then sarva lokam hi atmani pashyato bhavati atma eva sukha dukkha yoh karta. Myself is responsible for what he. And that's why the same kind of shlok is there in Unmad chapter also. Atmanam eva kartaram sukha dukkha. That shlok is also goes into the same line. Atmanam manyet kartaram sukha dukkhayoh. Then, so karmatmakatvacha hetvaadibir yukta, because in the next shlok he is going to give the details about hetu adi factors for pravrutti. So karmatmakatvacha hetvaadibir yukta sarva loko aham iti viditva jnanam purvam utthapyate apavargaya. So apavargaya, here we are talking about again moksha. It is one of the synonyms. Then this we can skip. This is very big commentary. Yes. Now here what they have given hetuvadi. So this is hetu, utpatti, vriddhi, upaplav and viyog. So all this has been. So what is important is upaplavo, dukkha, agamaha, and most important shadadhatu vibhago. That is what which is expected when we are talking about moksha. So further, tasya lokasya moolam sarva upaplavanam cha pravrutti. So when we are talking about this loka or utpatti, sarva upaplav. Upaplav is nothing but dukkha. So for sarva dukkhanam utpatti, it is nothing but pravrutti. Whatever we are doing here, you as well as me, that is also the cause for dukkha, actually. Nivrittir uparama. We need to stay away from these kind of things. So pravrittir dukkham, nivrittir sukham, ultimately. Correct? So this is what, and yes, this is also beautifully they have written. So here he says, somewhere last line, yes. Just a minute. Karya karaniyoho abheda upcharat bodhyavam. Because here we know that pravrutti is a karan actually, and the outcome is dukkha, whereas nivrutti is a karan and outcome is sukha. But here this sukha is permanent relief from the cycle of birth and death. But now this pravrutti and dukkha, nivrutti and sukha, they become karya karaniyoho abhedat, and that's why it is told that pravrutti is dukkha and nivrutti is sukha. Yat jnanam utpadyate tat satyam. That is the ultimate truth that everybody should know. Then pravrutti, the details have given. Yes, moha, ichha, dvesha, karma, mula, pravrutti. These 8 factors we all are aware about this. I will not go into the details. But yes, somewhere at least within a month or 2 months we should go through this. So at least some kind of introspection is done where I stand here. So because all of us are associated with these 8 factors. When we are talking about ahankar, then sangha, yat mano vakaya karma na pavargaya. Anything if you are doing which is not leading you to moksha, then that is not actual genuine karma. Then sanshay, this is okay. Sarva, this is aham srashta, swabhav sansiddho aham sharira indriya buddhi sattva vishesh. That feeling is again abhisamplav. Then this is what we are doing. Mama matru, pitru, bhratru. Even you are here, you are aware about, like you are continuously in touch. The moment you go outside, you will be talking to your kids, you will be talking to your family members, because this is abhyopat. And it is told that we should stay away from abhyopat. Correct? Then karya, akarya, hita, ahita. Now, like when we are talking about this routine practices, worldly, this is karya. But when it is in the context of moksha, it is akarya. We are not supposed to indulge into these things. But again, speaking is something different and following is again very different. One is, this is most important, I'll say. Now, if you see all religious practices, it is always told, even we also train. Okay, you should be doing prokshan, anashan, agnihotra, trishavan. These are all yajana, yagya, everybody should do. And now with like as everybody is aware about Indian culture and everything, we feel that this is very good. But now what he says, anupaya, you are not supposed to do this. This is all anupaya. So it is totally contradictory to what we are talking about, like religious kind of practices. So straightforward, it is told you should stay away from these religious practices. We should not be indulging. And it is somewhat contradictory. If you are on a big platform and if you say these kind of things, it will be a big trouble. That you will be considered as something nonsense kind of person. Correct? So a commentator has given, not this one I think. Next I'll go somewhere. For this, just a minute. Yes. Here he says, Prokshan ityadina anupayam. Why anupayam? Anupaya iti anya upaya. Because here the adhikaran is different. When your adhikaran is swarga prapti, then this is very good. You continue these practices. But when you say you want to have swarga prapti, it means indirectly you want to come back. So you want to be a part of this cycle. So for that, you continue these kind of practices. But if your adhikar is moksha, then all these things we should stay away from. So that's why anya upaya. And anya upaya, in many books it is told anya upaya iti swarga prapti and everything. So santo api parama purusharte mokshe anupaya. So this is not good, and they have given all these details that why this is not considered as upaya. Then nivrutti, yes, this is important. Nivrutti rapavarga, these are all synonyms. Prashantam, aksharam, brahma, moksha, this is our ultimate destination for Naishthiki Chikitsa. And this chapter actually talks about nivrutti upaya is nothing but Naishthiki Chikitsa. So now, so here they have given whatever there in pravrutti, we should stay away from that. So that's why he says tena avashtambaha yathokta kriya satam upasanam asatam varjanam. So whatever they have been telling since Sutrasthan first chapter, like indriya upakramaniya, then dharaniya vega concept. So we are supposed to stay away from those kind of practices. So, and what good is there? So that's why asangatir durjanena satyam sarva bhutam ahitam parusham anatikale pariksha vachanam sarva pranishu cha atmani eva aveksha. Further they have continued. Then very good, few things are good. Let me share with that somewhere. Yes, dhyana hetuho kaya nibandhanam. Now when we are talking about yoga and everything, many yoga gurus are there, but none of the yoga gurus are bothered about actual yoga. Here it is told dhyana hetuho kaya nibandhanam. So currently what we are talking about yoga, it is only kaya nibandhanam. Because after that, whatever we are supposed to do, we need to have that physical strength, so that after dhruti, you are supposed to follow those practices. And that's why dhyana heto kaya nibandham, then vaneshu aniketa vasa. Now this is again very difficult, because when we are talking about vanaprastha ashram or sannyas, we are going towards sannyas. You have left your home now. Aniketa vasa, if you are staying in the forest, then also you are supposed to have a home. You should be in open, like the animals, that kind of lifestyle we are supposed to follow. Then one thing you can read, this is Karyakala Atyabhayam. We need to have the fear, because day by day when you celebrate your birthday, actually it is a Karyakala Atyabhayam. That one more year has passed. There was one opportunity for you to start. We have missed that opportunity. So that fear should be continuous, that something good is still yet to be done from my side. So Karyakala Atyabhayam. Then Yoga Rambe Satatam Anirvedaha. Continuous we need to follow. So here yoga is not option. It is told it should be a part of your lifestyle, and at one stage everybody is supposed to start these kind of practices. Niyamanam Indriyanam, these are all common things, nothing new. Yes, sarva pravritteshu agasangya. So whatever they have told in those 8 factors, ahankar, etc., all those 8 pravrittis is nothing but aga, that is nothing but papa karma. So all those things should be considered as papa karma, and sarva sannyase sukham ityabhinevesha. Doing nothing, but that is not in our hand. So we have to do everything, but we should we should dissociate ourselves from whatever we are doing. Esho marga apavargaya, that is the only marga for moksha praptiti, and this is for us. Ato anyatha badhyate, then you will be here only. You keep on attending lectures, if you keep on giving lectures, and then you are trapped in this system. Correct? Then, yes, outcome of nivrutti upaya. Why we are supposed to follow this nivrutti upaya? Because this is sattva shuddhi. Because after that he says, without sattva shuddhi you cannot reach to that. So all these things are nothing but step by step. Here the training of physics is going on. The training of mind is also going on. So until and unless we have trained our mind, we have trained our body, we cannot become eligible for this. So now all these things they have given for etahi vimalam sattvam shuddhi upayir vishuddhyati. Throughout Samhita, we only talk about Sharirik Shuddhi. Nobody talks about Sattva Shuddhi. So actually this needs to be tried on criminals. Sattva Shuddhi Upaya. If like out of 10 criminals or 100 criminals, if we can change 2 or 5, that will be a big boost for our system. So Sattva Shuddhi Upaya they have given. Very beautiful examples they have given. So all these things, like these tools are required to clean the mirror, or when the sun becomes cloudy, and after that when it becomes sunny atmosphere. So certain things are required. So bhati sattvam tatha amalam jwalayati atmani saruddham. So what exactly happens after sattva shuddhi? He said it becomes shuddha. Sthiraha, jwalati. If you remember, the same kind of sentences are there after Shuddhaha. Archi becomes Shuddhaha. Sthiraha. Shodhan Sansarjan Kram. What are the benefits of Sansarjan Kram? Same, because there we are talking about Sharir Shuddhi. And here it is Mansik Shuddhi. So the mind becomes Shuddhaha, Sthiraha. And continue. So Prasanna Archi Deepo Deepashaye Yatha. A lamp which is not covered, which is Samrutayane, which is covered with the lid. So that example they have given. Then Shuddha Sattvasya Ya Shuddha Satya Buddhir Pravartate. Then only Satya Buddhi. So Satya Buddhi is not going to come after attending this lecture. That is for clear. Correct? If we can follow this, then only Satya Buddhi is going to come. So whatever we are doing, this is all Apara Vidya. Correct? Until and unless we follow. So Yaya Bhinati Atibala Maha Moha Mayantam. Because this is extremely difficult. Maha Moha, whatever prapancha is there, it becomes very difficult for us to think, to go beyond this prapancha. Yaya Bhavati Nispruha, Yogam Yaya Sadhayate. These are all the benefits. Sankyam Sampadyate, Na Upeti Ahankaram, Na Upaste Karanam, Sarvam Sanyaste. And after that, Yati Brahma. Ultimately, he reaches to the final destination. Nityam, Acharam, Shantam, Avyayam, Vidya Siddhir Matir Medha Pragyanam Jnanam Cha Samata. But this is only in Gyan. But when person reaches to this level, second line becomes obsolete. There is no existence of knowledge. This is the whole sequence they have given. Satya Shuddhi leads to Satya Buddhi, correct? Sattva Shuddhi for that, then Satya Buddhi, then Tamo Bhedan, then it is Nispruha becomes, then Yoga, Tattva Gyan, absence of Ahankar, stays away from Karan, no Ashraya because Sharir is not there. And now it is Sarva Sannyas, and ultimately the final destination is Brahma Bhuto, Linaha. Then, this is commentary here. Brahma iti moksham, this is what they have told. Yogam iti vishay vyavrutasya manasya atmani evam param yogam. This is the actual shortest definition they have given. Then ultimately this is moha moolam asthiram shantim nirestati. That shanti which was not there, which has got a base of moha or karan, now that will not be there. Brahma bhutosya sanyogo na shuddhasya upapadyate. So ultimately in the commentary somewhere he says atha jivan muktasya kim iti sukha dukkha hetu dharma adharma sanyogo na bhavati. Why he doesn't indulge into those kind of practices? So here they have given the details. Paschat eva param natu rajyate na api dvishata. He is beyond these two qualities. Brahma bhutasya iti brahma sadrushasya jivan muktasya iti vyakhyam sarvatha muktehi jnanam api nasti. If you have reached to that stage, then there is no existence of knowledge. Tena pashyat iti nasya. So sanyog specifically they have talked about dharma and adharma association, which will not be there afterwards. Then yes, why the signs are not there? So na atmana karan abhavat lingam, because in Sutra Sharisan first chapter, atma gya karanaira. With that only he indulges into various kinds of karma. So here Atmanaha karan abhavat lingam na upalabhyate. There won't be any signs. So sarva karan yoga, karan ayogat mukta iti abhidyate. So final destination for moksha is to become mukta. So the same extension is there. Something good. Here, na upalabh. Ultimately he has said it is not possible. Vana pravruti abhavacha sharir abhavo api artha labdayeva. There won't be any combination. So mana, buddhi, karmendriyani, that atma will not associate itself with all these entities, and that's a person reaches to that level. These are all the synonyms they have given in the details. Yes, this is the summary only of that chapter, where he says Shuddha Sattva Samadhanam Satya Buddhishcha Naishtiki Vichaya Purushasya Ukta Nishthacha Paramarshina. When we were doing undergraduation, we were only interested in these few words. Okay, whenever the examiner asks, you should bombard, yes, this, okay. The work is done. So, Naishthiki Satya Buddhir Eva Visheshanam. These are all the specifics. Naishthiki, Moksha Sadhika, and Nishtha is Moksha. So, previously also he has said that Nishtha is a synonym of Moksha, and whatever pravrutti we are doing, that becomes Naishthiki Chikitsa. Yes, this is from Mundaka Upanishad, where he says, Dve Vidye Veditavye, Brahma Vido Vadanti, Parachayeva, Apara. Two Vidyas are there. What is Apara? Whatever we are doing, Rigved, Yajurved, Samved, Atharvaved, Shiksha, Kalpa, Vyakaran, Nirukta, Chanda. This is all apara, and we are happy with this. Correct? But ultimately, atapara, yaya, tad aksharam, adhigamyate. So that we need to reach to that stage of akshara avastha. Same. So apara vidya is worldly empirical knowledge, and now everything has become empirical. More word is on practical aspects. So nobody is bothered about these kind of practices. So para vidya is the higher spiritual knowledge of the Atman, and ultimately the ultimate soul. So the goal of para vidya is to achieve moksha by gaining direct intuitive realization of the ultimate reality, transcending the limits of intellect and senses. We need to go beyond. Yes, this is the last slide. I was talking about that, though like I am going through this chapter since last 10 to 15 years, but this last pada is more important. Padam kala kramena. So to understand this concept, because like how we pursue the knowledge, acharya padam adatte, from our teacher. So being a teacher, whatever you teach, that is only 25%. Padam, correct? Padam shishyam, he himself self-directed learning. Shishyam swamedaya. Padam, society, friends, everything. And most important, this is going to come with time. So these are the complex kind of phenomena that is not easy to understand. We have discussed many reasons are there why our gati is not there in this kind of concept. But yes, as the time passes, gradually we understand what is moksha and how we can achieve moksha. So this was all about this presentations. Once again, thank you very much for your patient listening. You have been a very good audience. Okay. So if some questions are there, we can take up for 5 minutes. Or if you want to add something, not questions.
Sir, what's the difference between Sattva-Vajaya and this?
Correct. Very good question. Can anybody add? Then I'll speak. The question is, what is the difference between Sattva-Vajaya and this?
Sattva-Vajaya is Ayurveda or Ayurveda Mononigra.
Correct.
And we are not concentrating, the final effect is not, goal is not moksha.
Correct. It is only related to your physic and psyche, maybe what we can talk. Okay, for Sharir, and the main purpose I'll consider is Vyadhi Mukti. There is no concept. But yes, if somebody is trying, and to whom you are going to recommend Sattva-Vajaya? A person who is going to moksha, there is no need to. Correct? So Sattva-Vajaya Chikitsa is only for those individuals where we feel like all those diseases, whatever diseases we have talked about, in those diseases, so Sattva-Vajaya will be a part of treatment. And the ultimate goal will be Swasthasya Swastharaksharam and Aturasya Vyadhi Parimoksha. But this concept of Satya Buddhi or going to that level, it is beyond. Because it is at the first stage. So Sadvritta they have told. Whatever they have told in Sadvritta, it is going in line with Sattva-Vajaya Chikitsa only. Aityabhyo, Artyabhyo, Manonigra, that is a prerequisite. But after that, where you are going to occupy your mind, so it is told that you should be like, it should be in line with your soul, spirituality. In Sattva-Vajaya Chikitsa, that is not needed. There only Ahit Artha you restrict, that is sufficient. So there Sattva-Vajaya Chikitsa stops. So I can say only maybe that's a very superficial kind of concept for moksha. Correct? That is what my understanding is.
Sir, is it not possible,
Like not to attain moksha, I must say to reach somewhere near by staying in our, say, materialistic world, that no, in the sense in our profession, etc.
Correct.
And reach somewhere near it.
Absolutely possible, but it will take many births. It means if we are saying that we will be a part of this worldly cycle, and if you want to start practicing, because at one level comes where you are supposed to leave everything. And if you cannot do, then they have told Mohamayam Jagat. If you cannot break that cycle, then it is very difficult to reach to that level. Because if you are having family, correct? You are accountable to them. You are responsible for them. You cannot just say, okay, I am going moksha prapti. Not possible, na? So that's why this training might be going. And as I feel, na, ki birth after birth, gradually it is the education of the mind also that, okay, gradually I need to move into this direction. So maybe, okay, this birth you are doing it with the family. Maybe after few births, a level comes where a person will have an understanding that let us stop here now. So that stage will come. But at least if somebody is doing with all these things, still he is in the right direction. Direction matters. If he has started practicing that, it means not today, maybe after few births, he will be in a line. So certainly, that is also path. Because, and not if you are not talking about directly reaching to moksha, many of our problems can be we can stay away from those problems if you follow these kind of practices, isn't it? So certainly it is possible. Anything else?
So there is a karma and karma specific feature, right? Like what I mean is, if we commit some karma, will the karma phala come back to us in the same form?
Yes.
Or it is
With same intensity also. If it is positive or negative, it is going to come back. And that's why they have told, you watch it again and again.
if a person is murdering someone or deceives somebody,
Correct.
will it come back in the form of same murder or deceit?
Here what I believe doesn't matter, but what my Shastra says, it says, yes, not in this birth, next birth you have to repay it. This is a loan, you need to make it zero. Then only gradually you will be moving in this direction. So because karma, what is karma vyadi? Na? Karma vyadi is like this only. So certainly, 100%. 100%. And somehow this education is not a part of our routine education. Nobody is talking about that. Even say in the morning when we were talking about ethics and everything, like nobody is talking, it is not part of our education. Now since last few years, 3 to 4 years in this TCP program, I am giving exclusive lectures on moral values. That why it is important. Some videos are there, but I felt for this audience, that will be again embarrassing situation to show them that this is moral value. This is because we know what is moral values. But for them, to show with videos, it becomes more catchy for them. If I tell them, honesty is very good. Instead, if I show them a video where they themselves say that, okay, this is honesty. So that should be a part of our training somewhere. Now, with so much of our responsibilities and everything, we are least bothered.